Muy buenos días a todas y todos. Es un
Good morning,
placer
everybody. It
darles la
is a
bienvenida a esta
pleasure to
serie de
welcome you to this
internacionales de la
series of
Asociación
regional
Panamericana de
webinars
la
from
Salud
PAHO
sobre el tema de coinfección,
about
tuberculosis y VIH. Hoy va
co-infections
a ser el
between
primero de tres
tuberculosis and
webinars que
HIV.
estamos
Today, we're
organizando
going
desde la
to have the
Oficina
first
Regional de
of
la
three
OPS
webinars we're
y el
putting
día de hoy
together
va a
from
estar
the regional
dedicado, el
office
tema
in
clave
PAHO.
son las innovaciones
And the
diagnósticas
key
para la
topic
detección
today is
temprana
the
de tuberculosis en
diagnostic
personas que viven con
innovations for the early
VIH y con
detection of
especial
TB
énfasis en
for
el uso
individuals with
del test de
HIV, with most emphasis in the
lipoarabinomanano o
lipoprotein
TB-LAM.
and urine tests,
Quisiéramos
TB.
recordarles que tenemos
And
traducción
would like to
simultánea al
remind you that
español,
we have
inglés y
simultaneous
portugués.
interpretation
La sesión
in
está
English,
siendo grabada para
Spanish,
poder
and
compartirla
Portuguese.
con
The
todos
session is
ustedes y será
being
puesta en
recorded
la
to
página web
be
de
able
de
to
la
share it
OPS.
with you
Yo
all
soy Pedro
afterwards, and it
Avedillo,
will be
soy el
put
asesor
on
regional
in
de
the AHO
tuberculosis en la
website. I'm
OPS.
Pedro
Estaba
Avedillo. I am the
previsto
director
realizar
of the
esta
tuberculosis
presentación del webinar y la
section
moderación
in the
junto
Department
con
of
nuestro colega
PAHO
Omar Suet,
and
asesor de
in
detección y
or
tratamiento
in
de VIH,
WHO,
que
and we were
posiblemente
supposed to
esté
do it with
por
Omar
por
Sueta,
aquí.
our colleague, who
Para
may join
iniciar,
us
a mí me
afterwards,
gustaría
has the
darle la
representative of the
bienvenida y
Department of
la
HIV.
palabra a la
And to
doctora
start,
Mónica
I'd like to
Alonso.
welcome Dr. Monica
Mónica Alonso
Alonso.
es la jefa de la
Monica
unidad
is
de
the
VIH,
chief in the
tuberculosis,
HIV and
hepatitis y
tuberculosis
ITS
unit with
en la
also
Oficina Regional de la
hepatitis
OPS y nos va a
and
dirigir unas palabras de
STDs,
apertura
and she's
para
going to
ello.
give us some opening words
Doctora
for this
Mónica, por
event.
favor,
Dr.
adelante.
Monica, go ahead.
Gracias, Pedro.
Thank you, Pedro,
Muy buenos días.
and good
Realmente
morning,
es
everybody.
un placer enorme
It
darles la
is
bienvenida
really
a
a
este
great pleasure to
webinario
welcome you to this
y
regional
este webinario
webinar.
forma parte de
This
una serie
webinar is part of a
sobre
series
coinfección TB-VIH.
considering
Y hoy,
the
como Pedro ha dicho,
co-infection
está
between TB
centrada
and
en un tema
HIV, which is
clave
focusing
que
today on
son
a
las
key topic, as
innovaciones
Pedro said, which
diagnósticas
is
para
diagnostic
detectar
innovations to be
tempranamente la
able to
tuberculosis
conduct an early
en personas
detection
que
of
viven con el
TB
VIH, con un
in
especial
individuals that
énfasis en el
live with
TB-LAM.
HIV, most particularly
¿Y
in
por qué es tan
TB-LAM.
importante?
TB-LAM.
Porque la TB y
And
el
this is
VIH,
very
como
important
todos sabemos, son
because, as
problemas
we all
de salud
know,
pública
tuberculosis and
extremadamente
HIV are
importante. La
extremely important
tuberculosis
issues in
sigue
public
siendo
health.
la principal causa de
Tuberculosis is
muerte por
still the
una
most
enfermedad
important cause of
infecciosa
death
en
for an
personas con
infectious
VIH a
disease
nivel
in
mundial
people with
y también en
HIV in
nuestra
the world.
región, aunque hemos tenido
And also in our
avances
region, although we
con el
have
tratamiento
had a lot of
antirretroviral, el
progress with the
control de la TB, todavía
antiretroviral and the
presentamos
control
unas brechas
of TB,
muy
we
importantes,
still
incluso a
have
veces con
many
un
gaps,
estancamiento
even
o
with the
retrocesos
stagnant
en algunos
or
indicadores
sometimes a lay
relacionados con la
back in some
contaminación en
indicators
los
related
últimos
to
años.
the
Y
co-infection
entonces
in
es
the
un
last
desafío
years.
persistente que
So it is
tenemos y
a
que
constant
también se
challenge
van a
that we're
presentar datos
facing,
sobre
and
ello,
we're also going to
indican que
have
estamos llegando muy
data
tarde
about
al
it.
diagnóstico.
And
¿Cuándo?
it's telling us that we are
Clínicamente
getting
ya
to the
las personas
diagnosis
están
way
en una
too
situación
late
muy
when people
compleja
are
y
clinically
con una
facing a very
alta
complex
mortalidad.
situation
Sabemos que
and
el
high
diagnóstico de
mortality.
la TB en
We
una
know
persona
that
con
the
VIH es un
diagnosis of
desafío muy
TB
importante y que
in
no
a
siempre es
person
tan
with
sencillo, pues
HIV
porque
is
la enfermedad suele
oftentimes
presentarse
challenging
de
because the
forma
disease tends
típica,
to
hay
come
mayor frecuencia de
in
formas
a
extrapulmonares
typical manner
diseminadas
with
y
extrapulmonary
muchos
disseminated
pacientes llegan
characteristics,
con
and
una baja
many
carga
patients make
bacilar
it
o
in
no
with a
pueden
low
producir
bacillar load,
esputo.
or
Y la
they
evidencia
cannot
muestra como hasta
produce
el
sputum.
50% de las personas
So
con VIH
it shows
no
us
logran
that
producir esta
people
muestra
with
adecuada
HIV
de esputo, lo
can't
cual limita evidentemente las
produce the
estrategias
proper sputum
diagnósticas
test, and
convencionales.
this is going to
Entonces,
challenge
todo
the
esto
conventional
contribuye a que
diagnostic
una
tests.
proporción muy
So
importante
this
de
brings
personas
an
con
important proportion
coinfección
of people showing a
permanezcan sin
co-infection to
diagnóstico, con unas
remain
consecuencias
undiagnosed
altísimas en
with
transmisión y
terrible
mortalidad para
consequences
estas
in
personas.
transmission and
Entonces,
mortality
de
for
acuerdo,
them.
hemos presentado unas
So, of
limitaciones,
course,
pero
we
tenemos
have
unas
found
oportunidades que vamos
limitations,
a discutir
but we also have
hoy
opportunities
para
that we want to talk
permitir
about
modelos
today to be able
diagnósticos
to
de
move
TB
that
mucho más
diagnosis from TB
accesibles,
to more
simples,
accessible and
rápidas
simpler
y
tests that
centradas
are
en el
quicker
paciente e
and
incluso no
focusing on the
basadas en el
patient
esputo,
and not
que es
even
el
based
caso
on sputum,
del
which is the
TB-LAM.
case of the TB lab.
Entonces, bueno, desde la OPS hemos venido
So
trabajando
from PAHO,
estrechamente con
we
los
have
países
been
para
working
incorporar esta
very
prueba
close
que se
with the
va a dar
countries to
durante toda
incorporate
la
this
sesión
test. We're
y
going
otras
to refer
herramientas
to
diagnósticas
throughout the session,
innovadoras en
and
estos
some other
algoritmos de
innovative
diagnóstico,
diagnostic testing in this
promoviendo
diagnostic
lo que
algorithm
es la
to
visión
encourage
temprana en el paciente, el
the
acceso y la
patient-centered
atención,
perspective,
el punto de
access,
atención ahí
and the
donde está
point
el
of
mismo
care
paciente,
right
¿no?
where the patient is
La
located.
OPS ha apoyado a los
PAHO
países en
has been able
generar
to
esta
help countries in
evidencia, en
generating
intercambio de
these evidence
experiencias
and the
y la
exchange of
identificación
experiences
de
and the
barreras
identification of
¿no?
common
Entonces, bueno, gracias a este
implementation
esfuerzo regional
boundaries. And so
coordinado,
thanks to
hoy
the
estamos
coordinated
pasando de
regional
las
efforts is
recomendaciones
that we are
a
moving
la
today
implementación.
from
Ya no hablamos solo
recommendations
de
to
evidencias, sino de
implementation.
experiencias
We're not talking
reales que
about
están
evidence any
cambiando la
longer, but
práctica
real
clínica en nuestra
experiences that
región.
are
Entonces, en
changing the
este
clinical
webinario
practice
tendremos esa
in our region.
oportunidad
So
de
this
aprender
webinar
de
will
las
help us with that,
experiencias
to
de
learn
unos y
about
otros, tener este
experiences
diálogo
from
y
one
ver cómo
another,
podemos
to have
acelerar
this
la adopción de estas
conversation and
herramientas.
see
Y es
how can we
crítico
implement
cambiar
the adoption
ese
of these tools, which is
panorama
critical
de
to
la
change the
TB en
landscape
personas
of
con VIH en nuestra
TB in
región.
HIV people
Para
in our
hacer lo que
region,
estamos dispuestos a
to do
hacer, que
what
es
we are
salvar
willing
vidas,
to do,
¿no? Y
which is
acelerar el
saving
progreso hacia la
lives, and to
eliminación de la TB
accelerate
y
the
la
process
eliminación del
toward the
VIH
elimination
en
of
nuestra
TB
región.
and
Entonces, bueno,
HIV
agradecemos
in
su
our region.
participación
So we want
y
to
les
thank you for
deseo
your
un excelente
participation, and I
webinar.
want to
Muchas
wish
gracias.
you a wonderful and very successful webinar. Thanks a lot.
Excelente, Mónica. Muchísimas gracias
Excellent, Monica. Thank you very
por tus
much
palabras.
for your
Yo creo que
words.
Mónica ya nos ha
I
presentado
think
un
Monica has pretty
resumen
much
clave de la
given us a very
importancia
clear
y la urgencia que tenemos de
summary of the
acelerar la respuesta a
importance
la
and the
coinfección, la
urgency that we are
tuberculosis y el
facing
VIH
and
para poder acelerar así el
trying
paso
to
hacia
get away
la
from all these
eliminación y hacer prepararlo
situations
ya
and
todo el
facing
escenario
how to
para lo que vamos
achieve
a
that
ver el día
elimination,
de hoy,
putting
como
together all the
decíamos, muy
landscape of
enfocados
what
en
we're going to
intervenciones
address today, very much
diagnósticas.
focusing
Los
on
objetivos
diagnostic
del webinar
innovations.
que teníamos
The
para el día de hoy
objectives
es
of
justamente
today's
en ese
webinar
sentido poder
pretty
actualizar
much go
sobre
into
las
that
recomendaciones más
direction to be
actuales que
able to
tenemos de la
update the
OMS
most
para
recent
diagnóstico y de
recommendations
forma muy
from
concreta
WHO for the
revisar el rol, el
diagnostic,
papel que
diagnostic,
tiene la prueba
and
de
most
TB-LAM
specifically
y
look
otras
into the role that
innovaciones
TB-LAM and
importantes que
other
tenemos
important
para el
innovations and
diagnóstico. Y como
technologies
también
bring for
mencionaba
that
la doctora
diagnosis.
Mónica, poder
And just as
compartir
Dr. Monica
experiencias
has said
reales
it, to be able
de
to
países
share
que ya
real
están
experiences
implementando
from
y
countries that are
expandiendo el uso
already
de
implemented and
estas
expanding
innovaciones
the
y qué
use of
importancia
these
hemos dado
innovations,
nosotros, estamos
and
dando ese
therefore
paso
it's
importante
not just us
de la
alone,
recomendación
and we're already
a
given
la
that
práctica.
important step from recommendation
En cuanto a
to
la agenda del día
practice.
de hoy, brevemente
Pertaining
les voy a
today's
presentar
agenda, I'm
la
just
agenda.
going to
Vamos a
show
iniciar
you
con una
very
ronda de
briefly what we're going to
presentaciones
do. We're
cortas y
going to start
posteriormente
with a
vamos a tener
short
un
round of
panel de
presentations
experiencias de
and
países con estas
introductions, and we're
innovaciones.
going to have a panel of
Inicialmente vamos a
experiences from the
presentar una
countries with
visión
these innovations,
epidemiológica
and
regional,
then we're
un
going to give a
resumen
regional
de la
epidemiological
situación de la
perspective, a
coinfección, que va a
summary
estar a cargo de
of
la
the situation of the
doctora
co-infection, which
Belkis
is going to be
Marcelina,
under the
consultora
charge
del
of Dr.
equipo regional
Belkis
de
Marcelina, the
tuberculosis.
consultant of the
Posteriormente,
regional
el
team
doctor
of
Ernesto
tuberculosis.
Montoro nos
Then
va
Dr. Ernesto
a recordar
Montoro,
esas
who is going to
recomendaciones
remind us
de la
about those
OMS sobre los
recommendations
nuevos
from
métodos
WHO on the
diagnósticos,
new
incluyendo
diagnostic
el LAM
methods,
y también otras
including
innovaciones como
LAM and other
las pruebas
innovations,
cercanas
such
al punto de
as
atención.
the
Y a continuación, nuestro
MPOCs.
consultor también, el doctor
And
Antonio
then our
Camilo,
consultant, Dr.
consultor del
Antonio
equipo regional
Camilo,
de
a
VIH, va
consultant
a
of the
profundizar en
HIV
el
regional
uso
team, who is
del
going to
LAM en
delve
la
in the
práctica. Nos va
use
a
of
presentar
LAM
cuál es
in
la
the
situación
practice. So he's going to
regional
tell us
respecto a
about
la
what is the regional
implementación.
situation in terms of
Posteriormente, y de forma muy
implementation. And then
importante, la doctora
afterwards, very
Sumire
importantly,
Sacabe, del Centro de
Dr.
Referencia
Sumire
de
Sakabe
STD
from
AIDS en Sao Paulo,
the AIDS in Sao
Brasil,
Paulo
nos va a
Center
presentar
of Reference
cuestiones
in Brazil,
prácticas,
is
cuestiones
going to
muy
talk to us
específicas
about very
sobre la
practical
interpretación del
elements of
LAM
the
en
interpretation of
contextos
LAM
clínicos
in clinical
complejos.
contexts that are
Y para
complex.
finalizar, vamos a tener el
And
panel
to
con
conclude, we'll have a
representantes del
panel
Ministerio de
with
Salud de Colombia y del
representatives
Ministerio de
from the
Salud
Ministry of Health
de
from
Ecuador, en
Colombia
concreto
and
la
Ecuador,
doctora Sandra Ariza,
particularly Dr.
referente
Sandra
del
Riza, who
Programa
is
Nacional de
a national
Tuberculosis
referent
en
in the
el Ministerio
TB
de Salud de
program
Colombia, y la
for the Ministry of
doctora
Health in
María Gabriela
Colombia, and
Yarobi,
Dr. Maria
gerente del
Gabriela
proyecto de
Yarobi, who is the
fortalecimiento de la
project
promoción,
manager to
prevención
strengthen the
y atención
promotion,
del
prevention,
VIH
and
y
care of
testes de
HIV
coinfección
and
en el Ministerio de
STIs
Salud
and
de Ecuador.
co-infection in the Ministry of Health of
Estas
Ecuador.
representantes, nuestras colegas, van a
So
compartir
our
esas
colleagues
experiencias
are going to
concretas en
share
la
with us those
implementación del
specific
LAM y nos
experiences
van a
in the
compartir los
implementation of
desafíos
LAM, and they're
y
going to
los
share with
aprendizajes que
us
han
about
tenido
the
en
challenges
este
and learnings
campo.
they've had in
Esperamos de
this
verdad
journey.
que estas
So we
presentaciones les
really
motive y
expect
que
for these
podamos generar
presentations to motivate
posteriormente
you
un espacio de
and
preguntas,
generate
de
that space
discusión
for
y que esperamos pues sea
questions
muy
and
enriquecedor
discussion that
para
we
todos. Así
expect
que
it
sin
would be
más,
very
damos
enriching for everybody.
comienzo
So without
a las
further ado,
presentaciones y ahora me
we are
gustaría
now
dar
going to
paso
start with the
entonces a
presentations
la
and the
doctora
introductions, and I'm
Belkis
going to give the space
Marcelino
to
para que nos
Dr.
presente la situación de
Belkis
la
Marcelino
coinfección
so she can
en
tell
la
us
región.
about the
Belkis, por
situation of
favor, adelante.
co-infection in the region. Belkis, go
Muchas
ahead.
gracias. Muy
Thank
buenos
you very
días a todos
much,
y
and
and good morning, everybody. Thank you also for the opportunity to now
very quickly talk about how the situation is in the co-infection of tuberculosis and HIV. Let me know if you see the screen.
Sí, Belkis, se ve, gracias.
Muchas gracias. Entonces, como mencionaba tanto la doctora Mónica como
Okay, so as
Pedro,
Dr. Monica has said, and
la
Pedro as
co-infección
well,
sigue siendo un
the
problema importante de
co-infection
salud pública en
continues
en
being a
las
very important
Américas. Como
situation
podemos observar,
and public health for the
el
Americas. And as you can
11%
see,
de los casos
11%
de
of
tuberculosis
cases
está
of
vinculado
tuberculosis
a la coinfección
are
por
related
entonces
to
VIH.
co-infection,
Y de estos
TB,
casos,
HIV.
como
And
pueden
these
observar, el
cases, as you can see,
26%
26%
de las
of them,
muertes está vinculada a
26%
la
of
coinfección
deaths
tuberculosis
are
VIH.
related to that
Ustedes pueden ver
co-infection,
de la brecha
TB, HIV. So as you can see, the gap of those diagnosed, about 77,000 cases of people who could not be diagnosed with tuberculosis, 14% in that gap has to do with HIV, people who were not detected. And this high mortality then has to do with that. 1 out of 4 people dying with TB are linked with the infection of HIV. So it's an important public health issue. High mortality then in tuberculosis and HIV co-infection is a challenge that we're facing in the Americas. And therefore, in this series of webinars, we will be looking at those strategic interventions we need to implement to reduce mortality. There is an important topic here, and it is to be able to reduce mortality that we need to advance in the coverage of preventive care in tuberculosis. And only 1 of every 4 people living with HIV have access to a preventive treatment. And as you see, 18% of contacts. So these high priority group, these 2 high priority groups aren't accessing preventive treatment. And the challenge is to be able to reach at least 90% of coverage in these groups. That may be one of the reasons of high mortality and the co-infection TB, HIV. As we have said before, we have the trend to compare between 2015, 2024 in the region of those that were estimated by WHO and the co-infection that we're talking about here, TB, HIV. We found a slight reduction when compared with 2015. However, in 2024, we had not been able to reach all the efforts of reduction prior to the pandemic, where we have brought it down to 7,700 deaths. We still have deaths above from the data we had in the pre-pandemic season. What gets our attention is that we find it to be stagnant and the variation, so there's a 0% variation, it's still high mortality. What is this high mortality due? Probably. It may be to putting together tuberculosis and HIV, when tuberculosis is still the most important cause for hospitalization and death in people with HIV. And this paper shows all the causes of death in tuberculosis as causes of hospitalization and death of people who live with HIV. When we analyze the cascade of care, which is where we are looking to be able to help reduce mortality, we found that in the last years, basically it's been stagnant, and about 10,000 people with the combination TB and HIV were not diagnosed, and out of them, and the diagnosis, the 36,000, and then we found 25,000 people afterwards, 10,000 of them were not diagnosed. It's a 72%. And 10,000 people out of the group of 15,000 were not diagnosed. So that may be having to do with this.
hay que reconocer que los países
We must
avanzados
acknowledge
en
that
la
countries
cobertura
have
del
progressed
tamizaje de
in the
VIH para el
coverage
caso de
of
tuberculosis.
HIV
Tenemos
screening
las
in people
metas
with
muy cerca
tuberculosis, and
de
we have
alcanzarse en el año
goals that
2024.
are very close
84%
to
de
be
las
reached in
personas
2024.
con TB
84%
diagnosticadas pudieron
of
acceder a
people
conocer su estado
that had
serológico de
tuberculosis
VIH. Hay
diagnosed were
países
able
que
to
han
learn
logrado
about their
incluso el
serologic status
100%.
in
Muchos
HIV,
países
and
ya han
some countries
avanzado
were even
hacia
able to
esta
cover the
cobertura. Sin
100%.
embargo, en la región
But
todavía
many
tenemos
people
una
and
brecha
many
de
countries in the
un
region have not been able to
16% de
get
personas
there.
que no
So we
conocen
still
su
have
estatus
a
VIH. Y
16% of
los
people
resultados que
there
habíamos
that don't
mencionado,
know
el
what is their
12%
HIV
de las
status.
personas
So
que se
11% of
realizan la prueba
people
de VIH son
that
coinfectadas TB y
were
VIH en la región.
receiving,
Y
they
esto se ha
received the
mantenido
HIV
de
test
manera una meseta
are
estática en
still
los
like
últimos.
static in that kind of flat position
Otro
in the
dato
last years.
que nos llama mucho la
Another
atención y
piece
que
of
nos sigue
information
preocupando
that
en la
is
región
very
son los
important and that is
resultados del
very
tratamiento
concerning in
en
the
los cohortes
region
de las
has to
personas
do
con
with the results of
tuberculosis y
treatment in the
VIH. Como pueden
cohorts
ver,
with
sin
those that
cambios desde el
have the
2015,
combination TB
todavía
HIV
estamos
without
teniendo
any
un
changes since 2015. We still
54%
have a
de éxito del
54% of
tratamiento, muy
success
similar a la
in
historia
the
natural
treatment,
de la
very
enfermedad
similar
sin
to the
hacer
natural
nada. Si no estuviéramos
history of the
haciendo
disease,
nada,
doing
un
nothing.
paciente con TB en el
And so a
50% de
patient
los
with
casos va a
TB
curar
in
totalmente,
50% of
va a
cases
morir.
may
Y como
cure
ustedes pueden ver,
spontaneously or die.
las cohortes están
So
estáticas
the
desde el año
cohorts
2015.
are static since 2015.
20% de letalidad en
20%
el
of
2022,
lethality in
15% de pérdidas en
2022,
seguimiento. Sumado a estas
15%
pérdidas,
in
habrá que
follow-up.
sumarlo
And so added to
al
these
desenlace de
losses,
mortalidad, porque
this
un
loss in
paciente con
follow-up would
tuberculosis
have to be
sin
linked into
tratamiento y
mortality
en un caso de
because a
paciente
patient with
VIH
tuberculosis and
probablemente el
without
desenlace
treatment,
va a
and if
ser
it's
la
HIV, the most
muerte, porque
sure
necesitas el tratamiento para
outcome will
poder
be death because you
sobrepasar
need the
esta
treatment to
enfermedad.
be able to
11% de los
overcome the
pacientes
disease.
no fueron evaluados.
11% of
Sumamos
patients
esto
were not
y estas
evaluated.
cohortes sin
So
cambio indican
we find
que
this in this cohorts
dadas en el
without any
seguimiento
change.
de las
We
pacientes con
understand that there
tuberculosis y
are
VIH, los
uh,
infectados, probablemente
restrictions
también
in the
algunos países
follow-up
han
to these
mencionado
patients that are infected.
dificultades en
Probably
los
some
sistemas de
countries
información, pero
have
la
it because they
letalidad
have
lo más
reported
probable es que esté
issues in these
asociado a
information
esa
systems,
demora
but most
diagnóstica,
possibly
pacientes que están
has to
llegando
do
muy
with that
tarde al
delay in
diagnóstico de
diagnosis.
TB y por
Patients that
ende
are reaching a very late
la
TB
letalidad es mucho
diagnosis,
más
and
alta,
therefore
que es
lethality
lo que
is
queremos
much
ver en
higher,
el webinar del
which is
día
what
de
we
hoy,
want to
cómo
talk
podemos
about
tener
in today's
diagnóstico y más
webinar, the
oportunidad de
how to get
reducir
to a
esta
more
alta
timely
tasa de
diagnosis to
letalidad.
reduce
Una
such
de
a
cada
high
cinco personas con TB-VIH
lethality
fallece
rate,
durante el
mortality rate,
tratamiento.
where we have a high
Y
percentage of
probablemente
patients dying
uno de los
during
principales
treatment
problemas, y
because
para
they
eso
got
vamos
to
a
it too
tener
late.
incluso otro webinar solo
We're
de
also going to
prevención
have
de
another
tratamiento
webinar
preventivo, es el
specific
acceso
to
a
the
la
preventive
prevención.
treatment. And
Solo
so the
uno de
topic
cada
here would
cinco
have to do
personas
with
con
access to
VIH
prevention.
recibe
Only
tratamiento
5% of
preventivo de la
people
tuberculosis.
with HIV are
Ustedes pueden ver,
receiving
tenemos países
preventive
como
TB
Haití, a
treatment.
pesar de
And we
incluso
find
de la
countries such as
situación, ha
Haiti
presentado una tasa
that
de una
has
cobertura
had
cerca del 90%.
a
Cuba,
coverage
El
in spite of
Salvador,
everything
Nicaragua
close to
también han presentado
90%.
tasas muy
Cuba,
altas.
El
Sin embargo, la
Salvador, and
mayoría de
Nicaragua have also
países
shown
de la
a high
región se
coverage.
mantienen
However,
por debajo
most
del
countries
promedio
in the
regional
region
del
remain
26%.
below the
Entonces, hay
26%
desafíos en el
of the regional
tratamiento preventivo,
average.
que es una
So there are
oportunidad para
challenges in
evitar
the
la
treatment
tuberculosis y por
and the
ende
preventive
la
treatment,
mortalidad
which is
en
important to treat
personas
tuberculosis and then mortality
de VIH.
in HIV
Tenemos muchas
individuals.
oportunidades para
So
acelerar
we have a lot
la
of
respuesta
opportunities
a la coinfección tuberculosis y VIH.
to
En la
accelerate
región
the
de las
response
Américas, signataria
to
de la iniciativa de
TB,
eliminación de
HIV,
enfermedades que incluye
and
tanto la eliminación de la
these all
tuberculosis como
initiatives
la de
include the
VIH.
elimination of
Tenemos
tuberculosis and
nuevas
HIV, of
herramientas
course. We have
diagnósticas,
new
tenemos un
diagnostic
arsenal,
tools.
el
We have
expert,
a
los
whole tool set,
e-punto-care,
expert
como el investigador que va a
MPOCs.
presentar
Um,
esto más adelante.
we're going to
Tenemos la
have a colleague
radiología
talk about it
digital
later
con el
on.
producto de
We
inteligencia artificial
also
Vector
have
Studio para
artificial
generar recetas
intelligence
rápidamente.
reading and
Existen ya un
TPTs,
documental con
shortened schemes,
bastante evidencia
HB,
de la
1HB.
atención
There's
integrada
a
del
lot
VIH
of
tratamiento
differential
dirigido a la adherencia y
approaches
por ende reducir la
with
mortalidad.
the
Y
importance of
sobre todo
adherence.
tenemos una
And
comunidad
therefore, we
que
have
se
digital
hace
tools to help us with
en la
these. And we
región
also
que
have a
también
network
debe
of
involucrarse para apoyar el tema de la
communities and civil
vinculación del
society
paciente, el
to help
cuidado y
into
extender el
the
servicio
enrollment of the
a la
patients
comunidad.
into a
La
care
OMS en el
treatment
2024
to achieve
publicó
this.
este
In
documento de
2024, the
actualización
WHO
para
published
mejorar la
this document
colaboración
to
de
update
VIH.
the
Anteriormente, 12
activities of
actividades
cooperation,
ahora se resumen
TB, HIV.
en
In the
estos tres
past,
grandes objetivos
there were 12
establecer y
activities phase. Now it has the summary of these three objectives to establish a mechanism for integrated TB, HIV, integrated services to reinforce governance and a quality service access and the planning and the person-centered services as a follow-up, but most specifically to reduce the TB burden on people with HIV and to reduce it has summarized it in detection and treatment of TB and prevention of TB in HIV patients. And both the prevention for either scenario, preventing of TB in HIV patients and preventing HIV in patients with TB. That way, we've been able to reduce mortality in those that live with either disease. And then to summarize, we conclude that the co-infection continues being an important issue that is bringing a burden and a load of mortality diseases and an excess of mortality. There are still many gaps in terms of prevention and preventive treatment and the timely diagnosis, treatment, and comprehensive care. Prevention is still being one opportunity that is not properly harnessed, and that the new diagnostic tools and the preventive tools provide an opportunity to speed the reduction in mortality for TB and HIV, and that we can end TB and co-infection, TB, HIV, but we need to put together the services of tuberculosis and HIV, reduce inequities, and to place people right at the core of that response, to be able to reduce mortality by tuberculosis and HIV may be impossible, but we're here together to be able to tackle those interventions and achieve that goal for the Americas to reduce mortality due to this combination. Thank you so much.
Excelente, Belkis. Muchísimas gracias por la
Excellent,
presentación. Hemos
Belkis. Thank you so
visto
much for the
con más detalle lo que
presentation.
ya también nos
We have
anunciaba en
found a
clase,
lot
la
of
inequidad y la
more
magnitud del
detail
problema
now
de la
and the
coinfección
magnitude
en
of the
VIH, y esas
co-infection
importantes
issue,
brechas, ¿no?,
the
que todavía
TB
vemos
HIV
y también se
combination,
comentaba al principio,
and
que
those
es el
important gaps that
retroceso
we had
en
talked
algunos de
about
los
even in the
indicadores
beginning,
para el diagnóstico, para
and
el
also the
seguimiento
lagging in
y,
some of the
como también
indicators
citabas, para la
for
prevención. Pero
the
creo que es muy
follow-up and
importante que también
prevention.
has
But I think it's
ilustrado
very
cómo
important as well that
afortunadamente
you've also
tenemos
shown
oportunidades,
how,
¿no? Las
luckily,
innovaciones
we have
tecnológicas, pero
many
también estrategias
opportunities and technological
innovadoras para mejorar
innovations and strategies
el
to
seguimiento, para
be able
mejorar la
to improve
integración de la
follow-up and
atención,
the
que yo creo que pueden
integration
ayudar
of
a cambiar
care
esta
into the
situación.
scenario to
Muy
change the
bien, colegas,
situation.
continuamos con la agenda.
Okay,
Más de
colleagues, we continue
300
with our
personas
agenda. More than
conectadas en este
370 people
momento.
are connected
Recordarles que
with us
tenemos
now.
traducción
I want to
simultánea y que
remind you
más
that we have
adelante vamos a tener un
simultaneous
espacio para poder
interpretation and
contestar
that we will
preguntas
later
que
on will
pueden
have a
realizarnos a
space
través de la
for
sección de preguntas y
the
respuestas, el questions
Q&A
and answer
at
que
the
tienen
end,
en la
the
parte inferior de
Q&A that
sus
you find
pantallas
at the
o
bottom of
en el
your
chat.
Zoom
Entonces,
menu
siguiendo con la agenda,
or in
vamos
chat.
a ver ahora con
So
más
to
detalle
continue with our
cuáles son las
agenda, we'll
recomendaciones
see in further
concretas que tiene
detail
la
what are
OMS,
the
tanto
specific
para el tamizaje
recommendations
como para el
WHO gives us for
diagnóstico
screening
en el
as
tema
well
de
as for the
tuberculosis en
diagnosis
VIH, y
and
con un especial
the
enfoque en
combination
esos nuevos
tuberculosis
métodos
HIV
diagnósticos,
and focusing on those new
como
diagnostic
mencionábamos el
methods,
LAM,
as we've
las pruebas
mentioned,
cercanas
LAM
al punto de
and in
punción, y ver cuáles son
NPOCs,
los últimos
and to
algoritmos
see what are the
recomendados en
latest
este caso.
algorithms that are
Para este
recommended
tema
for
es un
that.
placer
And
invitar al doctor
it is a
Ernesto
pleasure for me
Montoro.
to
El doctor
invite Dr.
Montoro es
Ernesto
asesor
Montoro for
de
that
integración de
topic. He
laboratorios
is
aquí en el
a
equipo regional,
laboratory
en la
integration
oficina
advisor here in the regional
Pergamino.
team,
Ernesto,
bajo,
bienvenido y te paso la palabra.
in
Gracias,
Washington.
gracias,
Welcome,
Pedro.
and I
Vamos a
hand it over
compartirlo
to you. Thank you,
pantalla.
Pedro. And I want to share screen.
Me dice si la pueden ver ya a modo de presentación.
Okay, let me see if you can see it.
Ahora ya está. Perfecto, Ernesto.
Ok. Bueno, como bien Pedro
Yes, we can see
anunció,
it. Okay, as Pedro
vamos a
had said
hacer
it,
nuestra
we are
presentación, vamos a
going
encaminar
to
hacia presentar cuáles han sido las
introduce what
recomendaciones
have
actuales, sobre
been the
todo para el
current
uso del TB-LAM,
recommendations from
así como
WHO for the
diferentes
use of TB
recomendaciones de
lamb
otras
and the recent
plataformas moleculares
recommendations from other
y cuál es el
molecular
algoritmo que se
platforms, as well
está
as the
recomendando
algorithm
también
that
para
is being
incorporar
recommended
en
to
personas VIH para el
incorporate
diagnóstico
in HIV individuals for the early diagnosis of tuberculosis. Here you can see what's been the summary of the policies and guidelines published by WHO in regards to the use of the TB lamp. And the first policy was published back in 2015. Then in 2019, there was an update of it. And then most recently in 2024, a quick recommendation was published. And in 2025, and the new edition of the consolidated guidelines and the cooperative manual, there were recommendations in the use of TB lamp for people who live with HIV. And in this case, we're going to see how this recommendation was based on the simultaneous or concurrent use of both tests, both TB lamp and low complexity molecular tests. Here we find that so far, that's the only test recommended by WHO for the diagnosis of tuberculosis in the patient's point of care. And the purpose of the use of these tests, particularly the recommendations for those that live with HIV, has the purpose to reduce the self-diagnosis and mortality due to tuberculosis. This is a test that is going to help the diagnosis of active tuberculosis, and it was the first recommendation in adults, teenagers, and children out of these infections, tuberculosis of HIV, that were going in an outgoing patient with symptoms that have to do with tuberculosis or HIV or advanced HIV, or serious patients that were in a maximum level. And it was important for those that have a CD4 lymphocytes recount of less than 200. The LAMP test is based on the principle of lateral immunochromatography, as you know, for the qualitative detection of the LAMP antigen from microbacteria in urine tests. And LAMP is a lipopolysaccharide component from the external cell wall of microbacteria. It's filtered by kidneys and detectable in the urine, particularly in patients HIV in advanced phase and disseminated tuberculosis. The detection of this antigen is going to show a serious scheme that demands immediate treatment, and the levels of LAMP in urine are elevated in people that have the co-infection, the TB HIV co-infection, and increase as the recount of CD4 lymphocytes go down. This is a very simple test, as we see. It can be done pretty much by anybody with minimal training. It isn't something that necessarily needs to be done at a lab with a specific infrastructure. That's why the WHO defines it as a point of care tests right at the patient's bed, where you would only need to test the urine with only 60 microliters and the cartridge and the card to be able to have results in less than 25 minutes. Why is this test a useful complement for the TB diagnostic algorithm, talking about how this has been incorporated together? The inclusion of these tests in the algorithms for the treatment of hospitalized HIV patients, outpatient or in hospitals, has been very important in the diagnostic performance. It also has shown to be very important when it's added to the diagnostic algorithm together with the LAMP and the simultaneous test, Expert MTB and the Expert Ultra. LAMPS has also an important added value for patients that can't produce sputum when Expert is not available in situ. And it can be conducted, that diagnostic can be conducted on the same day. And it's going to be critical for patients with HIV that have a highest risk of mortality and that cannot produce the proper samples for the diagnostic assessment. The benefits of this test, as we've said, is a quick test. It's simple, low cost. It does not require big instruments or infrastructure. It can be done at the point of care, and it can detect active TB, pulmonary and extrapulmonary with HIV patients as well, with 25 minutes of results. It offers optimal results with advanced immunosuppression, and there's a better performance in the combination of both methods. Here we find how the sensitivity can change from a 52% to 98%, according to the CD4 lymphocyte detection, where sensitivity would be lower and it increases when the counting is lower, with specificity for all cases that goes above 98%. The limitations of the test, this antigen can be found in all mycobacteria. Therefore, the test cannot discriminate, for instance, between Mycobacterium tuberculosis and other non-tuberculous bacteria. Sensitivity is variable, as we've seen. It is only indicated for HIV patients. It does not detect pharmacoresistance, and it's not recommended either for the follow-up in the treatment of tuberculosis. The practical considerations to keep in mind, therefore, for the introduction and the expansion of the LAM test, well, first, it needs to be an initial procedure for the country to report that test, to establish a team that can gather experts, technical experts from HIV and TB national programs. It also needs to define what is the core population and the location of the LF, LAM, and health centers, to define the location of the algorithm and the diagnosis of tuberculosis. Recording and notification tells us that the positive result will be recorded and notified as bacteriologically confirmed, to develop procurement plans for budget and sustainability of the test, and also to develop a training program, a gradual introduction plan, and a training program deployment for monitoring, supervision, and as well as quality indicators for it. For the latest recommendations published in between 2024 and 2025, it is then recommended to conduct this test in adults and teenagers with HIV showing signs and symptoms that were captured in an active detection of TB, or that seriously ill or have an advanced disease due to HIV. And at the same time, an automated NATS needs to be used, which is the one used in respiratory testing. And at the same time, the TB-LAM in urine test as an early or initial diagnosis strategy to be able to diagnose tuberculosis instead of a PMR with low complexity and respiratory samples. So this recommendation is telling us that both tests should be conducted in simultaneous. In the case of children with HIV or that have signs and symptoms with an active detection of pulmonary TB, then they also need to use the molecular quick test, the NATS. Remember, we're talking about the expert in respiratory samples and feces, and the LAM in urine as an initial diagnostic strategy to diagnose tuberculosis instead of just using the PMRs and respiratory samples and or feces. So this is a recommendation for children, quick tests, and simultaneous with the LAM. Only a few weeks ago, WHO recommended a new platform, and it is the only molecular platform so far that is recommended in the near point of care. Also, recommendation has been done in the swabbing and the sublingual or tongue swabs, and another recommendation, although not very validated for those that live with HIV, is the sputum pooling for molecular quick tests. So we're going to focus on these three recommendations. What are those that can apply for the cases of HIV, which are the MPOCs, as well as sample taken with tongue swabs? As I was telling you, this has been a whole new amplification test of nucleic acid of quick diagnosis in MPOCs NATs for the initial detection of tuberculosis without rifampicin resistance. It is recommended in the peripheral levels of health care systems, primary healthcare centers, and communities to guarantee access to this population. And then it's a lower unit cost than others as it is a case of expert turnout, and the conducting of the test is much below the cost of what right now we know as a cost of a molecular test. It is also recommended for adults and teenagers that have signs and symptoms of TB, pulmonary TB, or with a positive result in the pulmonary TB. Tests are used in sputum as initial diagnostic tests instead of the conventional methods as bacilloscopy. As you remember, bacilloscopy, because of its low sensitivity, we do not recommend it for the initial diagnosis. So that's why we now have quick molecular tests, which is one more that is added in this particular with the specificity of being an MPOC. Whenever not possible to obtain a sample of sputum, so whenever that person cannot produce, these MPOC tests are recommended in tongue swabs, initial diagnostic tests for TB. Products for which data fulfills the criteria to show that the tongue swabs were useful were also for Expert Ultra and Tune-Up, as well as Minidoc, that we are talking about the MPOCs. The diagnostic precision varies among products, which shows that the last one, Tune-Up, showed most sensitivity, which is than the Ultra, and the tongue swabs must be kept for situations when sputum wasn't obtained, which is something that can happen in people that are living with HIV, because this sample taken shows a lot less sensitivity when compared with the use of sputum. So it's the test of choice as long as sample taken is possible from sputum. When the person cannot produce a sputum, then you could have the option to conduct the tongue swab, even with people that don't have a lot of training, doesn't require that lot of training in both in MPOCs as with the conducting of expert and Tune-Up. As I said, sputum is still the sample of choice, and in this case is for adults and teenagers living with HIV. And also the tongue swab, as well as this quick molecular test and in MPOCs. But the concurrent and simultaneous testing with expert and LAM become the preferred strategy for people with HIV, and in a context when these tests don't have an expert, then MPOCs could be used together with the lateral flow when a respiratory test can be achieved, and then we can use the tongue swab. In the case of children, or we recommend it for children in the use with sputum, either expectorating or induced, still don't show an evidence that can be used. We're talking about the tongue swab. And if available, then the strategy of choice will be the concurrent testing together with the automated low complexity. That's an expert in respiratory tests and feces, and also for the lateral flow. As the new point of care don't show any rifampicin resistance or any other drug, all positive results need to be sent to locations where they have moderate complexity or low complexity testing to be able to measure rifampicin resistance at least. Here we see the recommendation of this new molecular platform of testing that is not only useful for the diagnosis of tuberculosis, but also for other diseases. We find that we can take that tongue swab from sputum, which is very important. It's very important that the tongue swab is done in circles on the tongue to be able to apply the most amount of sample, and then very simply, in a process that is very simple, in a equipment where we're going to have a heating and vortex process to then put it in cartridges in the Minidoc device, which gives us the amplification, and within 25 minutes we're going to obtain either negative or positive results for tuberculosis. The advantages of these new platforms in the MPOCs, you can do it in peripheral labs, as we said it before, particularly in places where you have primary care or mobile care centers or community centers that don't have labs. It can be conducted by health professionals with basic technical skills. It can be done with swabs from sputum or tongue swabbing. Expanding thus the access to these tests, it gives results within 30 minutes. I told you it can be used also for the detection of other diseases, influenza, COVID, HPV, and others that are in their development. And we can see the prices that we refer to when talking about the device and also the cost for tests.
In regards to the algorithms for the use of the test in people with HIV, we see that the algorithm is a guideline for fast decisions to start treatment and optimize diagnostic resources in people with advanced HIV. And the use of the algorithm will detect or improve early detection and the reduction of mortality by co-infection. We see here that this is the algorithm one that has been posted in the consolidated guidelines and the module 3 of diagnosis published by the WHO in 2025, where we started based on a presumptive case of TB. And it's important, it's already incorporated into this algorithm to know the HIV status of the patient. As you will see on the right of the graph, this is the first criteria for separation, and it can be a positive or negative serological burden, and it determines the path forward. And this is a second point of bifurcation that allows adapting the algorithm based on the clinical and epidemiological characteristics of each. We will be focusing on the right, as I was mentioning, where we know that the seropositive status of HIV, and we debated on the age group of its adults and teenagers living with HIV. We will simultaneously do the rapid molecular test, and regardless of the results that we obtain with one test or the other, we would have the different conduct. For example, we see if it's a native lamb with both tests, the person had a presumptive diagnosis with signs and symptoms of TB. What we recommend is a clinical reassessment. If the test is positive with non-detected resistance and positive or negative lung, we consider a positive case and we do treatment with first-line medications that does not detect resistance to rifampicin. If there's detected resistance, being it with the ESPER test and it can give us the LAM positive or negative test, we consider the positive test and we put treatment indicated for the cases of TB with our resistance to rifampicin or multi-resistance. In other cases where the test of ESPER is positive with no resistance to rifampicin or unknown resistance, and also positive or negative LAM tests, we will consider positive, and we could also do a review if there are traces and do a first-line treatment regardless of the clinical and epidemiological characteristics of the patients. And if necessary, we could repeat the test. And then finally, if the ESPER test is positive, also with traces, or a negative test, we consider it positive and we put treatment with first line. And then finally, in the last result, where we don't have result for the molecular test or the LAM, in this case, because the test has an error, it's invalid, what we would do is look at the case and repeat the test if necessary. And these results are valid for adults and adolescents as well as for kids younger than 10. Different than for kids, we took respiratory tests, fecal tests for molecular tests, and of course, to do the LAM in urine. We will now be showing you a simulation for a scenario of how we use a diagnostic algorithm in a scenario with high incidence of TB and HIV. And we see that we are in an ambulatory clinic where the LAM test is available, and also the
en el
Esper
laboratorio
Ultra is
dentro de las
available at the
instalaciones.
lab
La prueba de
within
LAN
the
se le
facilities,
realiza de
and the LAM test
inmediato
is
y
done
fue negativa.
immediately. It
La
was
muestra fue
negative,
enviada al
and
laboratorio para
the
por el
sample
Esper y la
was
prueba
sent
fue
to the
positiva
lab to do the
para
Esper, and the
MDB
test was
y
positive for
sensible a la
MTB and
rifampicina.
sensitive
Por
to
tanto, el
rifampicin.
tratamiento con
Therefore,
fármacos de primera línea
the
se
treatment with
inicia
first-line
inmediatamente.
medications is began
Otra
immediately.
simulación, aquí vemos el ejemplo
Another
que
simulation, we
muestra la
see the
importancia de
example
las
here.
pruebas
It shows the
vigentes en
importance
niños
of current
viviendo con
tests in
VIH.
children living with
La prueba en este caso es un
HIV.
hospital
The test
regional,
in this
la
case
prueba
is
de
a
LAN está
regional
disponible en la
hospital. The
clínica,
LAN test
la
is
prueba
available at
molecular
the
está
clinic. The
disponible en el
molecular test
laboratorio dentro de las
is available
instalaciones
at
y
the
la
lab
clínica
within
cuenta
the
con
facilities, and
capacidad
the clinic has
para
the
recolectar el
capacity
esputo.
to
Se
collect
realizó el LAN
sputum. We did
inmediatamente,
the
el
LAM and
resultado negativo.
immediately got
Se
a negative
dispuso de que
result.
muestra de heces
There was
desde el
a
pañal del
sample
niño
of
y se pudo
feces from the
recolectar
diaper
también
of a
una
child,
muestra de
and we were
esputo.
able to collect a
Ambas
sputum
muestras se
sample,
enviaron al laboratorio
and both
para
samples were
realizar la
sent
prueba
to the lab to do
molecular.
the
La
molecular
prueba de esputo
test.
resultó
The
negativa,
sputum
pero la
test came
muestra
out
de
negative,
heces
but
resultó
the
positiva
feces
y
test
no
came
se
out
detectó
positive.
resistencia a rifampicina.
There was no
Por tanto, el
resistance to
niño comenzó
rifampicin
el
detected. Therefore, the
tratamiento con
child started
fármacos
the
de primera
treatment
línea.
with first-line
Como mensajes
medications.
finales, vemos que
As
un
key
resultado positivo de
takeaways,
la prueba
we
del
see
LAM
that
en
the
pacientes
make
con
a
VIH y
positive result
enfermedad
in the
avanzada
LAM test
indica
in patients with
tuberculosis
a
activa y
advanced
requiere un tratamiento
HIV
inmediato.
disease
Un resultado
needs
negativo del
means
LAM
active
no
TB,
descarta
and
tuberculosis por la
LAM
sensibilidad limitada que aún
positive
presenta
doesn't
la
rule
prueba,
out
por lo
TB
que no se
because of
debe
the
usar
limited
como prueba
availability of the
como
test,
única
and therefore
prueba.
it cannot be
Los
used as a
resultados
single
deben
test.
interpretarse
The
junto con
results need to
evaluación
be
clínica,
interpreted together
el
with the
recuento
clinical
SV4
assessment,
y otras
the
pruebas
SE for
que
count,
permitan
and other
mejorar
tests
la
that can
precisión
allow
diagnóstica.
improving diagnostic
La prueba
precision.
del LAN salva vidas en
The LAM
pacientes con VIH
test
avanzado, enfermedad grave, cuando se utiliza correctamente. Es valioso en hospitales y cuando otras pruebas
saves
diagnósticas son
lives
difíciles o tardan
in
en obtener
patients with advanced
resultados.
HIV
Esta prueba del LAN
and
complementa al ESAT
serious
y otros
illness when
métodos,
used
formando
correctly.
parte de una estrategia diagnóstica integral y el uso adecuado del algoritmo nos va a permitir iniciar un tratamiento
It's
antituberculoso
very
más temprano y nos va a reducir los retrasos diagnósticos. Muchas gracias.
diagnostic difficult.
Excelente, Ernesto. Muchísimas gracias por la completa presentación sobre las recomendaciones que tenemos. Sabemos que no era fácil resumir tanto
As soon as
en el
we
poco tiempo que tenemos, pero recuerden también que la
excellent
presentación
presentation,
del
the
doctor
short
Montoya
time that we have,
tiene
but also
información
remember that
muy importante que van a poder
presentation,
revisar. Ya ha compartido Belkis en el chat el enlace donde se van
the
a
doc
incluir las presentaciones para que tengan a mano también este
information,
resumen de las recomendaciones, ¿no? Muy
and
importante
we have the link where we will
el
be
porqué,
including the
la
present
recomendación del
so that
LAM y
you
lo
can
que
have a
vamos
summary,
a ver a continuación justamente son
and it's
datos
the
que si
why for
bien
the
estas
recommendation of
recomendaciones están basadas en la evidencia mundial que existe, lo que vamos a ver en las siguientes
we'll
presentaciones es
be seeing
cómo
in the next
el LAM se está
presentations
introduciendo en
is
la
how
región y qué
the
resultados
LAM
se
is
está
being
teniendo, ¿no? Y
introduced in
por
the
qué
region and what
estamos
results we're
haciendo
having,
tanto énfasis
and
en
why
su
we're doing
expansión
so
hacia el
much
uso del LAM
emphasis on
junto
its
con las
expansion and the
pruebas
use
rápidas
of
y
the LAM
moleculares.
together with the
Bueno,
molecular
gracias Ernesto.
rapid
Ahora vamos a
tests.
profundizar, como les
Thank you so
decía,
much. We
con
will
el
now
tema del
delve
LAM
into, as I was saying,
y
with
para
the
ello
LAM.
me gustaría invitar
And for
al
this, I would
doctor
like to
Antonio
invite
Camilo,
Dr.
como ya les dije,
Antonio
consultor
Camilo.
del equipo regional de
As I said, he's a
VIH, que está
consultant of the
trabajando de
regional
forma estrecha
HIV
con muchos
team.
países de la
He's working
región en el
closely with many
marco
countries in the
del estudio
region within the
del
framework
proyecto de
of the
enfermedad
study of the
avanzada
project of
por
advanced
VIH y cero
disease
muertes
by
por
HIV and
VIH. El
zero
doctor
deaths
Camilo nos va a presentar el
caused by
uso del
HIV.
LAM en
And
personas
Dr.
con
Camilo will
VIH,
be presenting the
resultados de
use
la
of LAM in people
implementación
with HIV,
del LAM,
results of the
datos
implementation of
impresionantes.
the LAM
Adelante,
and
Antonio.
regional
Gracias.
figures.
Muchísimas
Antonio,
gracias,
go ahead.
Pedro.
Thank you.
Bueno,
Thank you,
pues
Pedro.
voy a empezar directo para
Well,
mantenernos
I
en
will
tiempo.
start so that
Desde
we
ya
can
hace unos 3, 4
stay on
años
time.
hemos llevado
And for
diversos proyectos de
3, 4 years,
implementación en la
we've
región
led
para
different
introducir
implementation
un
projects in the
paquete de
region
pruebas
to
diagnósticas
introduce
rápidas
a
para
package
personas
of
con enfermedad
rapid
avanzada.
diagnostic tests
En
for
la
people with
región,
advanced
dentro
disease
de
in the
estas pruebas
region.
se encuentra el
And
TB-LAM, el
within
cual,
these
como ya
tests,
nos
we have the
explicaron
LAM that,
previamente,
as was
estamos
already previously
implementando
explained,
para el
we are
tamizaje de
implementing
enfermedad por
for the
tuberculosis activa,
screening of
junto
active
con pruebas
TB
moleculares de TB. La
together
principal
with
que se
a
utiliza
molecular TB
en la mayoría de los
tests.
centros es
The main ones that are
la
used
prueba
at
de
most of the
expert, ¿no?
centers are the expert
Como tal, hemos
tests.
ya
And
implementado este
we have
paquete
already
vía
implemented this
distintos
package
estudios controlados
via
de
different controlled
implementación en varios
studies
países.
for implementation in
Actualmente
several
aún tenemos
countries.
4 países
We
que están
currently
en
still
curso, que
have
son la
4
República
countries
Dominicana,
that are
Colombia, Ecuador y
underway: the
Perú,
Dominican
y tenemos
Republic,
otros que están
Colombia, Ecuador, and Peru, and we have some that are about to
Esto
start,
nos ha dado ya una
um,
gran
like
riqueza
Mexico,
de
Argentina, and Bolivia.
información de
This
cómo se
has
comporta
really enriched
el
the
LAM en la
information on
población de
how the
personas con
lamb
enfermedad
behaves
avanzada
in populations with people with advanced um, diseases in this region. And I also want to thank everybody who has made this possible. Too many people to mention, but you know who you are.
Aquí les muestro
And I
los
now
resultados
want to
pues,
show
ya
you
combinados de todo lo que
the
hemos alcanzado
combined
hasta ahora.
results of
En
everything
total
that we've
hemos
reached to this
logrado enrolar a
point.
más de
And in
1,500
total, we've been able
participantes
to enroll
con
over
enfermedad avanzada por VIH
1,500
en los diversos
participants
países y
with
hemos aplicado
advanced
más de
HIV in
1,400
different
pruebas de
countries, and we've
TB-LAM.
applied more
De este
than
total de
1,400
personas con enfermedad
TB-LAM
avanzada
tests. And
hemos
from the
diagnosticado
total of people
368
with
casos
advanced
de TB, el
disease,
cual
we've
corresponde a un quinto
found
aproximadamente, casi un cuarto de todas las
368
personas con
cases
enfermedad
of
avanzada
TB,
que se
which
han
is
visto en estos
a
estudios
quarter of
y de las
the
cuales la
people
gran
with
mayoría ha
advanced
logrado
disease,
respetar totalmente,
and
un poquito
most
más del
have
80%.
had positive
Esperadamente ha
treatment.
habido una cantidad
And
importante de
there's been an
muertes,
important number of
5%
deaths,
aproximadamente, 5% de pérdida de
5%.
seguimiento. No
Um,
tenemos datos
we don't have
absolutamente de todas las personas
figures
que han
of
sido controladas
absolutely
aún, pero
everybody who
también
has been
por una
enrolled,
cuestión de
but
seguir con la
we will
implementación, ¿no?
keep going with the implementation.
El primer tema muy
The
importante y tal
first
vez la
very
lección
important topic
más
and the
grande que se deben de llevar de los
most
datos que les voy a
important
mostrar
lesson that
es
you need to
que el
take home
TB-LAM
from the data
ha
that I will show
funcionado
you
como una
is that
prueba
the LAM test has
complementaria
worked as a
en la que
complementary
nos ha
test
permitido
where
expandir la gran cantidad
this
de
has allowed
diagnósticos
us
de
to
TB que hacemos. Si
expand
utilizáramos
the
solo
number of
las pruebas moleculares
diagnoses
como expert y
and
cultivo,
only
en realidad solo estaríamos
molecular
detectando
tests,
a esta
we would
pequeña
only be
proporción de
detecting this
personas que
small
pueden ver
proportion of
aquí en el
people
diagrama de Venn,
that you
que
can
son
see here on the
aproximadamente un
Venn diagram, which
20%
are approximately
de
20%
los participantes.
of
El
participants.
resto de las
And
personas, que es
the
este otro
rest of the
60% que se
people,
ve acá,
this
se
other
detectan
60%
únicamente
here,
con TB-LAM,
are detected
ya sea
only
porque el
with a
expert y el
TB-LAM
cultivo salieron
because
negativos o porque estos no se pudieron
maybe
tomar
the
por las
culture came
condiciones
out
del
negative, or
paciente
because they
o
could
del
not be
centro
taken because of the
per se, que
conditions
no tiene
of the
acceso
patient
rápido a
or
estas
the
pruebas.
center that doesn't have rapid access to these
Aquí les
tests.
muestro
Here I show you
cómo les ha
also
ido a estas personas, o sea, dividiendo
how
dos
these
grupos.
people have
Las barras en azul
been
están mostrando a las
doing
personas que solo
dividing
tuvieron TB-LAM
in blue.
positivo
We
por
have
todas las
people
otras
who
pruebas
only had
negativas o que no se pudieron
TB-LAM
tomar,
with
y
positive
la
with the
barra que
other
está
negative
como
tests or that couldn't
polvorienta
be
con
taken.
durazno
And the mint
son las personas que tuvieron una prueba
bar is the
molecular o un
people who
cultivo
had
positivo, lo que sería como la
uh,
forma tradicional de
molecular
diagnosticar
test or a culture
tuberculosis.
post
Como podrán ver, la
the
tasa de
rapid
tratamiento es
test.
igual, o sea, alcanzamos
And
darle
as you can
tratamiento
see, the
más o menos la
treatment
misma cantidad de personas
is the
y la
same.
tasa de
We
mortalidad es
gave the
igual. E
treatment to the
incluso
same number
cuando
of people,
nosotros
and mortality rates are
censuramos
also
para
the same.
solo
So
ver
even when we
cuántas personas
censored
se murieron de los
to
que sí
only
alcanzaron
see
a
how
recibir
many people
tratamiento,
died of the
igual
people who
la
received
tasa de mortalidad
treatment,
es más o
the
menos la
mortality
misma.
rate is more or less the same.
Otro tema muy importante es algo con
Another
lo que
very
a veces se
important
puede
matter
batallar un
that
poco
sometimes
a
we
nivel de
can
implementación,
battle with
es
at
que
implementation level
los clínicos, el
is
resto del
that
personal de salud se
clinicians and the
sientan
rest of
cómodos
the
dando
health
tratamiento a alguien
personnel
que solo
can
tiene un
feel
TB-LAM
comfortable
positivo y que no
giving
tiene ninguna
treatment to
otra prueba
somebody
para
who
la
only has a
tuberculosis
positive TB-LAM and no
positiva.
other positive
Un poco
TB
la
test.
segunda gran
And the
enseñanza,
second
lección
great
que queremos
lesson
darles con
that
este
we want
webinario
to
es que
give you with
estas
this
poblaciones que van a
webinar
ser, como
is
ya
that
vieron,
these
una gran proporción de las
populations that will
personas a
be
las
a
que les
great
pueden hacer
proportion of the
diagnóstico
people
de
that can
TB
get
utilizando
the
las tres
TB
pruebas,
diagnosis using the
se
three
van a comportar
tests
igual que
will
las
behave the
personas
same than
que
people
se les hizo el diagnóstico con
who
cultivo
got the
o con una prueba
diagnosis with the
molecular.
culture or the
Y tal vez
molecular
la prueba
test.
más importante de
And
esto es
maybe the
que
most
aquellos
important
que no
test
reciben
here
tratamiento para TB
is that
se
those who do
mueren
not
mucho más que los
receive
que sí,
TB
y es una
treatment die a
proporción
lot more than those who
similar de
do. And
incremento
it's
en la
a similar
mortalidad
proportion
en
of
ambos
increase
grupos. O
in
sea, si
mortality
alguien
in
que
both
solo tiene
groups.
un TB-LAM
If
positivo no
somebody
le
who
damos tratamiento para
only
TB, se
has
muere
the
tres
LAM
veces más,
positive,
así como una
we don't
persona
get treatment,
que
dies 3 times as more
detectamos
than
TB
a
con un
person
expert o un
that we
cultivo, se va a morir
detected
de 3 a 4 veces
TB
más si
due
no le
to a
damos tratamiento.
culture or
Le
through
hace,
a
se comporta
culture
igual,
and
y pues hay que darle
didn't get
el
the
mismo peso a
treatment.
cualquiera de
So
las pruebas
it's the same
positivas.
behavior, and we need to give the same
Una
weight to
gran
any of the
parte de la labor
positive
que
tests.
hemos
Most
hecho,
of the
y
work
que
that we
es
have done,
tal vez de lo
and
que
that
más trabajo
maybe
nos da para el futuro,
that
es
is
identificar todas las
gives us
brechas que
more work for the
existen en la
future, is
implementación
identifying
y que
all the
no nos
gaps that
están
exist in the
permitiendo
implementation
pues llegar
and
al
that are
cien
not
por ciento de
allowing us to
efectividad
reach
en tratamiento y
100%
reducir como
effectiveness
toda la
in
mortalidad que
treatment
nos
and
podría estar
reduce
reducir
all the
por TB
mortality that
en la población
we
con
could
enfermedad avanzada
reduce
en la
by
región.
TB
Cosas
in
que hemos
population
identificado y
with
que hemos
advanced
visto a lo
illness
largo
in
de
the region.
distintos
Things
estudios
that we have
cualitativos que se han
identified and we
hecho
have
en
seen
algunos de los
along
países
different
participantes
qualitative
es
studies in some
temas
of the
de
participating
concordancia con los
studies
horarios nacionales
is
aplicar.
discordance
Por
with
ejemplo, no están alineados con las
national guidelines.
recomendaciones
For
o las
example, sometimes
recomendaciones de
they're
la
not
OMS
aligned or
y existen
updated with
otro
the
tipo de pruebas confirmatorias que pueden ser tardadas o pueden no estar
WHO
disponibles o pueden
guidelines, or
salir
there's
negativas y entonces
other
pone
confirmatory
en
tests that
situaciones
can be
difíciles
delayed or maybe are not
a las personas que
um,
están dando tratamiento.
available, or
Hay
this
veces
could
que los
put
servicios sociales
people
piden
in
procesos
difficult
especialistas. Estas
situations.
evaluaciones pueden
Sometimes
estar
they
muy
need
alejadas en tiempo,
assessments
pueden
by
ser
specialists
limitadas
and
o
they can
pueden no
be
estar
very
disponibles
far away in time, or
también
maybe they're not
las
available
fragmentaciones de los
soon.
programas de
And the different
VIH, pues puede
fragmentations
luego
of
tener,
the HIV problems
decisiones
can
o directrices
maybe
diferentes y esto
have
también
like
entra
different
en
kinds of
conflicto
guidelines, and this
pues
also
hace más difícil
goes
iniciar
into
tratamiento
conflict and
a las
makes it
personas con
difficult
TB
to start
positivo.
treatment
Todos estos
for people
puntos
with
se
positive TB
traducen
LAM. And
en
all these
más
points are
visitas
translated
médicas para
into
poder empezar
more
tratamiento,
medical
más
visits to be able
retrasos
to
y
access
en más
treatment, more
oportunidades para que
delays,
las personas
more
se pierdan
opportunities
en
for
el
people
camino a
to
recibir
get
tratamiento para
lost
TB. O sea,
along the
si
way to
el mismo día
receive
que recibimos a
a
alguien
treatment for
diagnosticado
TB.
positivo
So
con
if
un
the same
tratamiento,
day that we
es mucho más
receive the
probable que
person
esta
with a
persona inicie
positive TB
tratamiento a que
LAM,
si le
we
decimos,
can give them
llegaste,
treatment,
tienes
it's
TB LAM
better for the
positivo, en una
person. It's
semana te va
more
a ver un
possible
especialista, en
that
2
the
semanas
person
vas
will
a tener resultado
respond
de
to the
positivo, en 3
treatment
semanas
instead of getting,
pues va
oh,
a
you
llegar
have
al
a
tratamiento,
positive
te lo vamos a
TB
poder
LAM,
dar.
then
O
in
sea, en
2 weeks
esas
you
3
need to
semanas
see
se pudo
a
haber
specialist,
perdido
then
esa persona.
in 3 weeks you will
Otras
get
cosas que
the
hemos
treatment. We
detectado
could lose
como
the
cosas
person. And other
importantes
things that
son
we have
temas
detected as
de
important
protocolos
gaps are
psicoasistentes entre las
uh,
distintas instituciones que pueden estar tratando a estas
psychosocial
personas,
protocols in different
servicios
institutions.
fragmentados. Por esto me refiero a que a
Um,
veces, por
and
ejemplo,
they can be
si la persona
fragmented
se atiende
because
en el Seguro Social,
sometimes
pero se
if the
tiene que dar el
person has
tratamiento por el
the
Ministerio de
social security,
Salud,
but
puede haber
we
ahí
have to have
como
treatment through
fragmentación,
the
problemas
Ministry of
de
Health. There can
comunicación
be
entre ambos. Hay veces
fragmentation,
que los
problems
costos de
of
transporte son
communication,
prohibitivos,
sometimes costs for
desconfianza en los resultados de la prueba,
transportation
ya sea
are
de
prohibitive,
tanto los
the
usuarios, el sistema de
distrust
salud, como
in
del
the
personal de salud,
tests of
o
the
rechazo a la
users
atención.
and the
Todo
health
esto
professionals, or
traduciéndose siempre en peores
um,
desenlaces, ¿no? Y
denying
aumentos en
care.
la mortalidad.
So this translates into worse outcomes and increases in mortality.
Afortunadamente hemos podido tomar varias de
Fortunately,
estas
we have been able
lecciones
to take several of
aprendidas y
these
aplicarlas
lessons
en
learned and
algunos de
apply
los
them
países en donde estamos
in
trabajando
some of the countries where we're
actualmente.
working
Y pues esto
currently,
nos ha permitido
and
mejorar
this
esta
has
fase
allowed us
de
to
tratamiento y
improve
de,
these
pues, en
rates of
general,
treatment
de pues, de
and in
completar los
general
algoritmos clínicos,
completing the clinical
realizando
algorithms,
entrenamientos importantes con el personal de
doing
salud,
important
apoyando
training
con mecanismos
in
para
health personnel,
transporte, dando
supporting with
protocolos
mechanisms for
redundantes en donde
transportation,
más de una
giving redundant
persona
protocols where
revisa que
more
las
than
cosas se
one
hagan,
person checks that things are done,
produciendo procedimientos operativos estándar,
producing
también
standard
fomentando la
operating
cooperación entre los
procedures,
programas de
and
TB y VIH.
encouraging
Todo esto nos ha
cooperation between
permitido
the TB
mejorar
and HIV programs.
las
And this
tasas de
has all
tratamiento en
allowed
distintos
us to
países
improve
y tal
treatment
vez
rates in
donde
different
mejor
countries.
podemos ver
And
este
maybe where
resultado
we can
y es
better
parte de las
see this
experiencias que
result,
se
and it's
compartirán hoy, es
part
en
of the
Colombia,
experiences
en
that will be
donde
shared
si
today is in Colombia,
comparamos
where if we
la tasa de
compare
tratamiento y
the
diré
treatment
de
rate
completar todo el paquete
and for
diagnóstico que se
completing the
tiene que dar
entire
en estos
diagnostic
casos,
package
alcanzamos
that needs to
casi el
happen in these
90%
cases, we reach
comparado
almost
con 48% de las
90%
primeras
compared to
ejercicios de implementación que
48%
tuvimos
in the first
poco después de
implementation
la pandemia de
exercises that
COVID.
we had a bit
Una de las
after
grandes,
the COVID pandemic. And
grandes
one of
indicadores que
the
hemos podido ver
big
en Colombia
indicators that
es
we've been
la
able to
gran
see in
exposición de todo el
Colombia
personal de
is the
salud
great
y la,
exposure of
diré,
all
gran
the
fe que
health
tienen
care
en el uso
staff and
del
the faith
TB-LAM.
that they
Y
have
en
in the use
este
of the TB lab.
cuestionario que
And
hicimos a varios de
in
los
this
proveedores
questionnaire
de
that we
salud,
did on
podemos ver
several
que
of
en
the
general están
healthcare
totalmente de
providers, we
acuerdo
see
con
that
los
in general
beneficios de
they
utilizar el
are
TB-LAM junto
completely
con
in
esto y
agreement
se
with the
ve en los
benefits of
resultados de
using
lo mismo.
TB lab in this
Sin
population.
más, y para acabar
And
el
we
tiempo,
see
yo
this in the
quiero
results.
darles tres
And
mensajes para llevar a
I
casa.
just want to
La
give
primera
you
es que el uso
3
sistemático de TB-LAM
takeaways.
logra hasta triplicar
The
la cantidad
first
de
is that
diagnósticos
the
de TB que
systematic
hacemos en
use of
personas
TB
conectadas
LAM
por VIH.
is able or
Continuamos en
helps
alcanzar
us
el 100% de
triple
inicio de
the
tratamiento y
amount
trabajar
of
estas tareas
diagnostics
sistemáticas nos
of
ayudará a
TB in
reducir la
people with
brecha y
advanced
ya
HIV
hemos
if we
visto que se puede
continue
lograr.
reaching 100%
Y
at the
el no
start
dar
of
tratamiento oportuno a
treatment,
personas con TB-LAM
and
positivo
not
solo
giving
por dudar en la
timely
prueba o porque querer
treatment if
esperar
with
alguna otra
to
clase,
people with
pues se
positive
asocia a un
TB LAM
incremento de
just because we
mortalidad
want to
enorme,
wait.
que es hasta de
It's
3 veces
associated to
mayor.
a huge mortality increase over
Muchas
three
gracias por su
times
atención.
more.
Aquí dejo igual
Thank
mi
you so
correo
much for
para
your
poder contactar
attention,
seguido.
and I leave you my email in case you have any doubts.
Muchísimas gracias,
Thank you so much,
Ramiro, por
Ramiro,
todo este resumen
for
de
the
la situación
summary
de la implementación del LAM y
of
toda la
the
evidencia
implementation
que
of the
se ha ido
LAM and all
generando
the
con
evidence
esta
that has been
iniciativa.
generated
Yo creo
with
que es
this
muy
initiative.
importante. Antes veíamos
I think it's
comentarios
very
también muy
important. We used
importantes
to
en el
see
chat sobre
very
la
important
baja
comments on the
sensibilidad de las
chat
pruebas
on the low
diagnósticas en personas con
sensitivity of the
VIH.
diagnostic
Y bueno,
test
por eso
of
tan
TB
importante
in
poder
people with
utilizar
HIV, and that's
el
why it's so
arsenal que
important
tenemos
to be able to
disponible, ¿no?
use
El
the
LAM, las
arsenal that we have
pruebas
available.
moleculares
The
rápidas
LAM, the
en estas
rapid
personas con
molecular
enfermedad
testing
avanzada por
in
VIH,
people with
porque,
advanced
bueno,
HIV because
datos muy importantes que nos mostrabas de cómo
these very
triplican
important
el
pieces of data
diagnóstico y
you're
la
showing us
confirmación
how it triples
bacteriológica, ¿no?
diagnostic and
Muchísimas
bacteriological
gracias, Camilo. Actualmente
confirmation.
480
Camilo, thank you
personas
so much.
conectadas.
Currently, we have
Preguntas, como les decía, muy
480 people
interesantes.
connected.
En el chat, por
Very
favor,
interesting
sigan
questions in
compartiendo.
the
Sabemos que
chat.
muchas
Please keep
se van a ir
sharing.
respondiendo
And
a
we
medida
know
que
that we
avanzan
will be
las
answering
presentaciones,
many
pero si
as
no,
the
contestaremos en
presentations
los
go
chats
on,
o, como
or else
decían, la
we
sección que
will
tendremos luego. Vamos a
answer in
seguir
the session that
hablando y
we will have later
profundizando
or on the
más
chat.
en el
We will
tema
keep
del
delving a
TB-LAM
little bit
y en
more
concreto
into the TB
ahora me
LAM,
gustaría
and
invitar a la doctora
concretely now
Sumire
I would like
Sakabe
to
de
invite
Brasil. La
Dr.
doctora
Sumire Sakabe
Sakabe
from
nos va a
Brazil. Dr.
hablar
Sakabe
sobre un tema
will
muy
talk to
práctico
us
y muy
about a very
importante, que es la
practical and very
interpretación
important matter.
del LAM
It's the
en
interpretation
personas
of the LAM
asintomáticas y
in
los falsos
asymptomatic
positivos. Muy
people
importante,
and
doctora
false
Sakabe, tiene
positives.
la palabra. Adelante, por
Dr.
favor.
Sakabe, the floor is yours.
Muchas gracias,
Please.
muchas gracias por la
Thank you so
invitación
much
a
for
Dr.
your
Pedro,
invitation,
doctora
Dr.
Belkis,
Pedro
doctora
and
Mar.
Dr.
Es un
Belkis.
honor estar
It's
con
an
ustedes.
honor to be with you.
Buenos días a todas las personas
Good
que nos
morning,
acompañan.
everyone
Bom dia a
who is
todas
here
as
with us
pessoas
today.
que nos acompanham. É privilégio estar com vocês aqui.
It's a privilege
Eu vou
to be
conversar
here in
pouco
this
sobre
conversation.
interpretação
I want to talk a little bit about the
naquela hora que
interpretation
ele é reagente e o indivíduo não tem sintoma. Será
and
que isso é
what
um falso
happens with
positivo?
an
Acho que
individual
essa é uma
that
questão que permeia a
has
nossa
no
prática
symptoms.
diária
Is
com
it a
bastante
false positive?
frequência.
I think it's something that is in our daily practice in a frequent
Não tenho
manner.
conflitos de interesse nessa apresentação.
I have no conflicts of interest in my
Queria começar
presentation,
mostrando a vocês aqui
and I
onde
would
que
like to
fica o
start by showing for
lipoarabinomanane.
all of you where we
Onde
have
fica o lipoarabinomanane, que é a
lipoarabinomanano
glicoproteína que é
or
detectada aqui no teste
the
rápido que nós
lipoprotein
temos
detected
disponível.
here in the rapid test that we have available.
É uma glicoproteína que fica ancorada,
Lipoarabinomanano
fica
or LAM
grudada na parede
is a
celular das
glucoprotein that is
micobactérias. Já
anchored,
foi dito
stuck
antes
to the
que ela não é
cell wall
específica de
of
Mycobacterium
mycobacteria.
tuberculosis. Ela
And
fica
we,
presente
and this
na
is not
parede celular
specifically for
das micobactérias. Então, aqui a
bacteria,
gente tem o
but it's
granuloma,
stuck to
dentro
the
dela a gente
cellular
tem a
wall of
micobactéria, e na parede
bacteria. We have
celular
granuloma in the cell wall. The doctor's audio is breaking off. We are not
se
able to
romper
hear.
quando ela rasgar. E isso acontece em duas situações. Ou
When
quando
this
a
breaks,
micobactéria
this
está
happens in two
degradando, quando ela
situations.
está
Either when
morrendo, a parede
mycobacteria
está
is
abrindo,
degrading,
ou quando essa
when it's
micobactéria está
dying, the wall
efetivamente
is
ativa,
opening,
quando ela
or
está se
when the
multiplicando,
mycobacteria
quando ela se
is
divide em
active,
duas, a
when
parede
it
se rompe
multiplies,
e o
when
lipoarabinomanano se
it's divided
desprende da
into, and the
parede
wall
celular, cai na
breaks,
corrente sanguínea, é
and the
eliminada na urina
lamb
e é passível de ser
gets out of the
detectada,
cell wall,
então, no
it
teste
goes
do
into the
LF-LAM.
bloodstream, and
Alguém
it's
perguntou no
eliminated
chat,
through
ficou
urine, and it's
triste,
easy to
perguntou
detect it
por
in
que que a
the
gente considera
lamb
isso como
test. Christian asked in the
diagnóstico
chat why we
de
consider this
tuberculose,
a
diagnóstico
diagnosis
bacteriológico.
of
Essa é
TB
uma detecção antigênica.
or a
Como quando a gente
bacteriological
faz
diagnosis.
teste
It's
rápido
about
de
a
antígeno para
antigenic
COVID. A
detection.
gente
When
faz
we
a
do
detecção de
the
antígeno que é
rapid
presente
antigen test for
naquele
COVID,
agente etiológico
we do the
daquela doença.
detection of an
Então, eu
antigen that is
concordo com você,
present in
Christian,
the
que talvez não seja o termo mais correto
biological
dizer
agent
que
of
é um
this disease.
diagnóstico
I agree with you.
bacteriológico, porque
Maybe,
eu não estou
Christian, it's not
encontrando a
the most
bactéria
adequate
inteira,
test. It's a
mas é um
bacteriological
diagnóstico
diagnosis because I'm not
microbiológico, é um
finding
diagnóstico
full bacteria,
antigênico.
but it's a microbiological bacteria diagnosis
Por que
that
a
is
gente
antigenic.
detecta antígeno que está presente na membrana
Why do
celular
we
de uma
detect an
bactéria que está
antigen that is present
metabolicamente
in the
ativa,
cell membrane of
multiplicando?
a
A
bacteria that is
detecção do LAM
metabolically
na
active,
urina,
multiplying
ela
the
denota
detection
a
of LAM in
detecção de uma
urine
micobactéria que está ativa, que está
shows the
replicando, e,
detection
portanto,
of
isso
active
significa
mycobacteria
detectar doença
replicating, and
ativa.
therefore this means detecting an active
A detecção do
illness.
LF-LAM na urina, ele também
The
decai o
detection
tratamento. Aqui nesse
in
gráfico a
urine
gente tem que depois da
generates
segunda semana de
treatment. In this
tratamento,
graph, we
o
can see
decaimento
that after the
no
second week of
LF-LAM é
treatment,
bastante abrupto.
the drop
Portanto, de novo,
if
a
in
detecção
LF-LAM
de
is
LAM na urina
significant.
denota
And
que
once
tem
more, the
micobactéria
detection of LAM
multiplicando
in urine shows that
e
there's
detecta, portanto,
mycobacteria
doença ativa.
multiplying
O tratamento
and
faz com
detects
que
therefore
esta
an active
detecção
disease.
diminua e,
And the
muito embora
treatment
o
makes that
teste
the
não esteja
detection
autorizado para ser
reduce.
utilizado como controle
And
de
even that if
tratamento,
the test is
a
not
presença de
authorized to
LAM
be used
positivo
as a control for
significa
treatment, the
necessidade de
presence of LAM
tratamento para
positive
a
means
tuberculose.
then the need for treatment for
Do ponto
TB.
de vista técnico, falsos positivos com LF-LAM podem
From the
acontecer porque ele
technical point
cruza
of
com outras
view,
micobactérias, como já foi
there
dito
can be failures because
anteriormente.
it crosses
Eu
with
trago
other
aqui duas
mycobacteria, as
casuísticas
we
só para
talked
ilustrar,
before. I
mostrando
wanted to
que
show two
em
cases to
pessoas
illustrate
mais
that
avançadas,
show
no
that
CD4
in
baixos,
people
a
that are more
presença de
advanced,
culturas de
low
outras
CD4, the
micobactérias
presence
causando
of
doença
cultures from
disseminada,
other
aqui, na maioria das
mycobacteria
vezes, ave, mas
causing
também
disseminated
cansaço e também
disease, most
extracelulares,
times
estão relacionadas à positividade no
with
LF-LAM.
intracell issues. This is all related to LF positivity, and in this case, with a greater number of patients, there has been a 90% LAM positive information, and in more advanced patients with not disseminated tuberculosis, and in an analog matter with TB, also with mycobacteria with non-TB, LAM detection is a test that is not very susceptible. It means that most of the people with TB that will get a negative LAM test. It's not very sensitive, and it fails to find people with TB with LAM, and it's excreted in the urine of people with TB, even with people that have HIV. When we do the search and detection of LAM in a person with HIV, and we can do this through urine test, and we can see when LAM is present. We know that it's present in urine of people with TB. And the problem is that in the test that we have available, it's only able to detect a huge amount of LAM, and not the small amounts. Therefore, it's a test that it's more sensitive for people with high TB burden. And the problem is that the bottleneck would be the test and not the idea. LAM is present in the urine of people with TB, but the instrument that we have to see this LAM today is an instrument that needs a huge amount of the antigen in urine, and it only works for people with more advanced disease. But what we want to know is what we do with people with negative cultures in this case, or with no symptoms of TB, people who have reactive LAM, and sometimes that causes discussions in clinical practice. And we have two explanations to this. The first one is based on the fact that the physiopathogeny of TB, we've learned that TB is a bipolar disease. We have in one pole the latent disease, and in another pole the active disease. And if we analyze this graph, we have a non-infected individual, and they get infected, and if the first point of entry is not able to contain the infection, this individual will get infected and will get a granuloma that can persist stable with contained infection during the entire life of the person. We call this the latent infection. If this granuloma is reactive, the person will evolve and get reactive TB, this LAM positive TB, a molecular positive test, positive culture. What happens in this is a relatively new concept, that the path between latent infection and active TB is halfway along the way, where the granuloma has already opened, the mycobacteria came out of its latency stage, and it's replicating and releasing FLAN in the bloodstream, eliminated in urine, and before the person feels symptoms, before the person has alterations in the x-rays. And the most important thing is that the path of latency for active disease is not unilateral. Look at that, the arrow has 2 points. The person can go out of latency and try to go to active illness, but this could go back. And when we have an advanced person asymptomatic with LAM positive LF and normal X-ray, the individual has no symptoms, and we're possibly detecting the moment where the open granuloma is replicating mycobacteria, and the patient hasn't presented symptoms. The second important point is remembering that the granuloma, the persons affected by HIV have a less efficient granuloma. It's not very competent because the granuloma depends on the immunological cellular response for it to be contained, and the latent infection can be seen. We depend on several cellular tests and T lymphocytes so that the granuloma can stay closed. So people with HIV Granuloma is more loose and with more frequency can open, allowing the replication of mycobacteria that are detectable in the left lamp culture and evolving for active disease. And therefore, there's an increased risk of our patients to evolve to active TB. And we have to remember that this path, ladies and gentlemen, even though the figure is horizontal, this is a path that is bilateral. It comes and it goes. So we have along this line an infected individual, they do a granuloma and latent infection, and at certain point in their lives, they decide that this granuloma cannot just do everything. And it opens, the microbacteria opens, it replicates, there's no symptoms, no x-rays, but in this subclinical disease stage, there can be a positive culture with no symptoms, and very possibly in this stage, there can have positive lamb without symptoms, and I can evolve to the disease, and I can cause people that maybe with their immune system can contain the open granuloma, and the person who's sick can go back to their latent state. So when we have a reactive lamb in a person with HIV, probably we have the fortune of verifying when the granuloma was open, and I was able to see, therefore treat this person right now or without symptoms, is a win for this person because they have the opportunity to open the granuloma in the future and assess for active illness.
And therefore, to conduct the treatment for tuberculosis is mandatory for this type of individuals. I expect my presentation was enriching for everybody, and thank you so much.
Doctora Sumire, de verdad, muchísimas gracias.
Thank you so much,
Una
Dr.
presentación
Sumire.
muy
Thank you so
clara,
much for the presentation. Was
también
very clear.
con dudas. Bueno, muchísimas
Well,
gracias por
a lot of
comentarnos más
questions
sobre cómo
probably, and thank
funciona
you
la
so
prueba,
much
¿no?
for
Y
telling
qué
us further about
resultados
how this test
funciona. Y veo que
works
encontramos
and
dudas
where
muy
does it
importantes
work. I
en el
think there
terreno, ¿no?
are
Los
many
colegas que están
questions
implementando
on the go
estas pruebas sobre la interpretación y
and
creo
on the
que
field for
ha ayudado
colleagues that are
a
working
clarificar
with this. I
muchísimo.
think it's
Doctora
helped
Sumire nos
clarify a
acompaña y
lot.
también va a estar
Dr.
disponible
Sumire
para
is
seguir
going to be with
contestando más
us
preguntas que puedan aparecer.
and
Muchas gracias.
available to letting us know any
Bueno,
more
vamos a
questions that
continuar
could
con
come up.
la agenda y ahora vamos a dar paso al
We'll
panel,
now
que es el
continue with
espacio
the
que
agenda.
tenemos
This
para poder
is the
hablar o para
space we have
poder
for
presentarles sobre
the
los
panel to be able
desafíos
to
para
talk
el
about the
diagnóstico oportuno
challenges for
de
the
la
timely
tuberculosis en personas
diagnosis
con
of
VIH. Para este panel
tuberculosis
hemos
for
invitado a
HIV
representantes de dos
patients.
países que están
And
avanzando
we have
en la
invited
implementación
representatives from two
del LAM
countries
y para
that
que puedan
have moved on in the
contarnos de
implementation
primera
of
mano los
LAM
desafíos que están
so that they can tell
encontrando
us firsthand what are
en
the
la implementación
challenges they
y
have
los
found in the
aprendizajes que también están
implementation
sacando
and
de
the
estas
lessons
experiencias.
learned from
Me
these
gustaría
experiences.
invitar y agradecer a la
So
doctora
I'd like
Sandra Ariza,
to
que es
invite
referente
and
del
thank
Programa
Dr.
Nacional
Sandra Lisa. She
de
is the
Tuberculosis del
referent of
Ministerio
the
de Salud
National
en
Program of
Colombia, por estar
Tuberculosis
hoy
in the Ministry
aquí
of
con
Health
nosotros. La doctora
of
Ariza
Colombia.
va
Thank
a
you very much for being here
presentarnos
with us.
su
Dr.
experiencia
Arisa
en la
is going to
reducción del
share with us her
diagnóstico
experience in the
tardío,
reduction of
experiencia
the late
temporal en
diagnosis
tamizaje, en la
and experience to
implementación
improve screening and the
de abordaje de la enfermedad
implementation and
avanzada.
the approach
Doctora
of the
Ariza, un
advanced
placer
disease. Dr.
recibirla.
Arisa, it is a pleasure to have you with us. Microphone's all yours. Thank you, Doctor. Thank you very much. Give me a minute.
¿Me confirman si se ve la presentación?
Vemos su PowerPoint.
Please let me know
Puede
if you see my
ponerlo en modo
presentation.
presentación.
We see the PowerPoint, please, if you can try and put it in presentation mode.
Muchas gracias.
Ahí,
Bueno, en
ahí.
primer
Thank you very
lugar,
much.
muchas
Okay, so
gracias
first of
por la
all,
invitación.
thank you for
Para
the
nosotros
invitation.
es
It
muy
is a
importante
pleasure
poder
for us,
socializar esta
and it is very
experiencia
important for us to also be able to
nuestro
share
país,
this
del Ministerio de
experience
Salud y
from our
Protección
country
Social.
and the Ministry of
Pues
Health and Social
queremos
Protection,
comentar todo lo que ha sido la
sharing
implementación de
about
esta
what
estrategia
it's
y
meant to do to work with the
eh,
implementation of this
invitar a otros
strategy and to
países a
invite
sumar
other countries
al
to
desarrollo
join in the
esta
development
implementación.
of
No es fácil,
this implementation.
pero
It's
vamos a
not
avanzar.
easy,
Entonces,
but we are
como decía el doctor,
moving
vamos a
on. So
hablar de
just
la
as
reducción del
uh,
diagnóstico tardío, una
it's been
experiencia
said, we're going to talk
de
about the
mejora
late
del tamizaje
diagnosis
y
and
la
the experience and
implementación
the
del abordaje
improvement of
generalizado que hay
screening,
aquí en
the
Colombia
approach in the advanced disease of HIV in Colombia. And to give you a little bit of a context, in Colombia, this is a concentrated epidemic, mostly in young men from 20 to 39 years old, where 58% of them are specific populations. So it's mostly to men having sexual intercourse with men and people that consume drugs and injectable drugs, mostly with the breast syndrome and tuberculosis in a 6.3%. And through a mechanism which is established tuberculosis in 1.34%, histoplasmosis and 0.76%. That's the report of these presence. And the tuberculosis in Colombia, there's an estimated incidence of 49 cases for 100,000 people, putting us, that's in the 2024, with a 38.98 of notification and a mean risk with an inverse behavior in the region. Now, this is the number of prevalence cases, with the prevalence being HIV in Colombia, as you can see, is 1.09%, and it remains in Colombia. This is our mortality, our incidence rate, where we can find a number of cases and the rate with that important reduction for 2020 and the beginning of a recovery that showed a peak in 2023 that has shown stabilization. In regards to co-infection, the average of serological status in the country is 95%. We have an average of co-infection of 11% in patients with known serologic status. The average of people infected with HIV dying before they begin their treatment is going to be 2.7%. And the average of individuals that die during the treatment is a 23%. And so we've evaluated that there's an early mortality in people who have the combination of TB, HIV before 90 days, which is leading us to prioritize the program of HIV and tuberculosis together with PAHO, working with this protocol of research protocol and histoplasmosis and tuberculosis and crypticosis in advanced patients. For us to reach this specific point, we started with an adaptation and implementation process where we had to work with a normative updating, program and governance updating that has led us, and I think is one of the most important learnings in the process, to an articulate work that we need to strengthen to be able to achieve a good adaptation and implementation, and that shows to be efficient. Planning and organizational preparation to be able to establish what are those capabilities, the process analysis, boundaries, and since our country has a healthcare system that is very different to many in the region, makes it very important to have a good organizational plan preparation. And then in terms of education strategies and the strengthening capabilities, this is conceived not only for the human staff, but also for those that are receiving the treatment, because oftentimes we're at hospitals and they're going from tertiary to a primary healthcare levels. And so it's important to work with the adaptation. Also working with the restructuring, the organizational redesign processes. It is important to facilitate diagnostic routes. Also working with the facilitation and support the implementation which is very key because the constant assistance, technical assistance, problem solving to be able to sustain the adoption of that intervention is really paramount. I must highlight the work being done by the advisor that we have, Isabel Cristina. Also working with the monitoring, feedback, and adherence, assurance, the follow-up of indicators, audit, and assessment. All of that is absolutely key to be able to measure how are we doing in the implementation. And then finally, sustainability and institutionalization. So we're going to share with you how is it that we are addressing sustainability in the country. So this is a study that is being conducted in 5 cities and 7 institutions. We're present in the cities of Medellín, Armenia, Cúcuta, Santiago de Cali, and Bogota, with all of these institutions participating from the project. It has 2 phases. Phase A implies an observational and intervention phase. What's most important here initially is the identification of the eligible population, validation of that eligibility, the decision of inclusion, and the gathering of information and follow-up. So when we work with the intervention phase, what we do is we clearly apply that identification of the eligible population and the recollection of information and follow-up. And so this first part is where we're going to apply all the process and actions that correspond to the criteria of inclusion and exclusion and the algorithm to consider. With all of that, then it's important to remember that as inclusion, we have the diagnostic of HIV according to the national algorithm, the advanced HIV disease, either confirmed or assumed, without effective antiretroviral therapy. The exclusionists haven't received systemic antifungi treatment, anti-tuberculosis for 14 days prior, and haven't been enrolled within the 90 days before. Once with that, we're assessed a set of symptoms and work with 2 groups, those that are asymptomatic and those that are symptomatic. And we're always going to have the CD4 as marker to know if the person has this measurement been done in the last 90 days. And according to that, we're going to establish a whole package of HIV care where we begin with the antiretroviral and we'll then work with the CD4 counting, the preventive TB vaccination, and they put together with different social economic programs. If symptomatic. If the patient is symptomatic, then we are going to conduct testing. If there's respiratory symptoms, what we do is we guarantee a molecular test to be able to ensure the continuity. We take histoplasm tests, cryptoglucosis. If the patient did not show CD4, then conduct CD4s, and to all individuals who move them into a comprehensive management. So in terms of tuberculosis, it's important that if it is negative, we continue the working if there are symptoms, and if no symptoms are present, then I go to TIP-T and TAR if they have negative molecular tests and are not symptomatic. So more clearly, this is going to be the description without emphasizing so much because we already talked about it, but this is what it looks like, the work that we have been doing. In the system, though, it's not so easy to be able to have this articulation because oftentimes molecular tests are more fragmented and we need to guarantee care routes that are going to be communicating and integrating. Therefore, the articulated work is very important. These are part of the progress and results we have. We expect to have 554 people in the intervention phase. Right now, we have the 80.1% with 444 enrolled individuals. In the symptomatic section, we have 285, where we have 258 lamp positive, 117 have a laminin expert. At the same time, out of this same number of individuals, we have a number confirmed of 132 with tuberculosis. And we have 107 TB treated. In the asymptomatic section, we have 159 individuals, that's 35.8%. 159 are asymptomatic, where 21 of them showed to be LAM positive and 2 had an expert detected. So it is important, and part of what has been addressed with the other speakers, to consider that here we also have this spectrum of tuberculosis. It shows an important number. So out of this, 21 were positive in LAM, and we started 17 of them in treatment. In terms of the follow-up, clinical follow-up to 30 and 90 days, it is important to also bear in mind that these are different moments. And so that's why we're going to find information that is not going to be accumulative. At the first moment, 30 days, we had a follow-up done to the total of people where 335 were alive. 27 of them had already shown a condition of death. 34% were in the loss of follow-up. These are early losses, and we had a remaining of 48 in follow-up. 90 days after, according to the cohort, and as people are coming in, we have 230 people. We had 14 that died, 34 that remain. We haven't had any more losses on 166 cases that are in continuous follow-up. So the main challenge here is not only the clinical part, but the operative part. There is a lapses in the closing of the 90 days. But if that doesn't allow us to give us a good conclusion on survival, it's key to understand that we are still active in the follow-up. Well, we found were 166 cases with some kind of opportunistic presence, histoplasmosis, cryptococcal. So histo was 9.6, crypto was 4.8, and TB was 71%. So it's important to highlight that it's the same behavior that the literature shows, and it still is something that is helping us diagnose a lot more versus what we had done before. Also, and the combination of histo and TB, we have 6.6%, crypto, TB 6.6, and the 3 infections together were only shown in 1 patient. This has helped us to improve our TARF because in our country, TARF is not higher than 70% in cases of co-infection. So we increase the onset of preventive treatment and the onset of trimethoprim treatment as well. And the most important findings we have, the most impact in those that have advanced symptomatic disease, TB-LAM, having a lot better performance in this population. Therefore, its use needs to be prioritized in patients with clinical signs, asymptomatic screenings that show low performance. It is possible to implement it with a limited diagnostic input. We find that positive help us save lives, and for that TB to then would not to be developed further in a symptomatic manner. There are still gaps in the care cascade because not all diagnosed cases translate into the onset of treatment, which can reduce the impact of the program, as Antonio said it, where we had shared part of the situations that they have found, and that's where we're working to try and remedy this when we don't feel so confident with the test, which implies to also be constantly talking about it and communicating so that we can go into a process of national implementation. It is important to have the diagnostic confirmation and follow-up and to improve the use of complementary molecular quick testings and to ensure the timely enrollment into treatment. Today, the national guidelines considers the test more like a screening, but the idea is that it remains as a diagnostic test. And some lessons learned, the follow-up and systematic technical support in regular spaces for the analysis of cases and mortalities is an exercise that has been conducted and has been really key. The implementation of strategies to guarantee the constant supply of complementary tests to prevent interruptions in the screening. Also, the identification and management of bottlenecks in the onset of the TB treatment and actions to ensure timely enrollment and promote preventive treatment, and to also strengthen spaces for dialogue and conversation and technical assistance to facilitate standardized assistance in the country and technical exchange. We have a big lesson learned in the intersectoriality and programmatic integration in the need to update the normativity and the TB Land program, which is included there as one of the most important pillars to strengthen this part. So we have to constantly be working with the updating the normativity, the preventive care as well, and the routine intervention together, putting it all together systematically, and the programmatic articulation between TB and HIV, not only nationally, but within each of the regions as well, to improve results to favor coordination and continuity. In terms of sustainability, we are very lucky to have a country that has a very robust fund from the World HIV Fund that brings different activities to work with an expansion throughout the country, and then take these results and the experience of these implementation to continue working with it in time. Its incorporation in the normativity, the programmatic actions, and the technical capability in the different levels that allow to institutionalize this strategy, and to ensure not only the permanence, but scalability and continuous improvement together. I must thank everybody, particularly Dr. Cielo Rios from the National HIV Program, our collaborating researchers in the country, the PAHO Colombia and regional PAHO teams for the constant support in these matters. Thank you so much.
Muchísimas gracias, Sandra.
Thank you,
Gracias, ¿verdad?, por
Sandra.
compartirnos la
Thank
experiencia
you very
del
much for
país, esos
sharing
avances
the experience
importantes
of the
que
country,
están
the
realizando
important
en la
progress
implementación
that
del proyecto, pero también avanzando
the project
hacia
implementation has
cómo
shown, but
convertir
also
todo esto en una
moving
política
toward how
pública
to
estable.
create a
Vamos a
stable
saltar
public
ahora
policy
a
with it.
Ecuador. La
And now we're
doctora
going
María
to jump
Gabriela
to
Girovi,
Ecuador with
gerente
Dr.
del
Maria
proyecto
Gabriela
Fortalecimiento de la
Girovi.
Promoción, Prevención,
She
Atención
is
del
the
VIH, ITS,
manager of the
Subinfección,
project
Hepatitis Virales y
of
STIs
strengthening
de Ecuador.
promotion, prevention of care
Doctora
with
Girovi, es
HIV,
un
STIs,
placer
TB,
enorme tenerla aquí
HIV,
con nosotros.
co-infection and viral hepatitis from the Ministry
Le
of
paso
Health
la
of Ecuador.
palabra
It's a
para que
pleasure to
pueda
have you.
presentarnos la
And without
experiencia
further
del
ado, I
país
hand you the
en
microphone so
maximizar
you
la
can tell us
implementación
about
del
the
LAM
country
a
experience
lo
in the
largo de los diferentes
standardization of the
sistemas
LAM
de
implementation through
salud.
all the various
Adelante,
health
doctora.
subsystems. Go ahead, doctor.
Muchísimas gracias
Okay, thanks a lot.
a todo
I want to thank
el público que nos acompaña esta
all our
mañana,
audience
a
this
todo el
morning,
equipo de la unidad de
the
TB,
whole
VIH,
team
hepatitis
of the
víricas y malaria
TB,
de Washington,
hepatitis,
con todo su equipo extenso de
viral
TB y VIH.
hepatitis and
Gusto
malaria in
verlos,
Washington,
saludarlos.
everybody, to
Asimismo,
see
a
you
UPS
all and
Ecuador
reach you
por
all.
permitirnos
And
como
Bajo
país este
Ecuador
espacio de
for
intercambio
allowing us as a
de
country
experiencias.
this
No
time
sé si me
for
pueden, por favor, comentar si están
experience exchange.
visualizando la
Please let me
presentación,
know
por
if you can
favor.
see my
Sí,
presentation.
doctora, sí.
Yes, doctor, we
Gracias.
can see it. Thank you very much.
Bueno, nosotros
Okay,
vamos a
so
conversar. Perdone
we're
por la
gonna,
fonía, pero
I'm
ya
sorry
nada,
for my throat.
tenemos un tema de
So we
comentarles
have
cómo fue nuestro
the task to
vivo de
tell
buena
you
vid nuestro atrevimiento
How
de lanzarnos
is
hacia el
it that we
como
dare
país.
to jump
El
to
Ecuador es un
as a
país
country?
bien
Ecuador
pequeñito en
is quite a
Sudamérica,
small
pero ya vamos a
country
conversar sobre eso. Bueno,
in
vamos a
South
conversar
America,
sobre un poco de los antecedentes
and we're
cómo
going to
está
tell
la
you a little
situación
bit
de
of our
coinfección,
background.
cómo fueron estas
How is the
fases de implementación a
co-infection,
lo largo de
how
los
the
años
implementation
y qué pasó
phases
con los
have
otros
been
subsistemas
throughout
que
the
nos
years, and what
competen como
happened to the other
respuesta
subsystems
nacional
that are under our
en el
care as
Sistema
national
Nacional de Salud
response in
y
the
finalmente
national
concluir con
healthcare
el tema de
system,
oportunidades,
and
brechas y
then
retos
wrapping up
en cuanto a
with
este biomarcador.
opportunities, gaps, and challenges
Para
on
darles
this
una idea,
biomarker.
nuestro país es un
To give
país
you an idea,
multicultural,
we are a
andino,
multicultural Andean
tenemos
country
18.4
with
millones de habitantes, estamos
18.4
conformados por 4
people in
regiones.
population,
Es un
4
país muy
regions.
diverso y muy
It's a
bonito.
very diverse and
Al momento
beautiful
nosotros
country.
tenemos 24
Right now,
provincias
we have
¿Por qué hago
24
mención de las 24
provinces.
provincias?
And I
Porque
mentioned
en
these 24
marzo de este
provinces
año,
because in March
administrativamente
past,
hablando, el Ecuador
administratively
tuvo,
wise,
debido a un decreto
Ecuador
ejecutivo,
went through an
administrativamente
executive
cambiamos
decree where we
de coordinaciones
administratively
zonales a
changed
provincias, lo que puede
from
ser un desafío cuando se
area
implementa
coordinations to
una
provinces,
prueba de
which can be a
diagnóstico como
challenge
fue
when
en el
implementing a
caso de
diagnostic
TB-LAM.
test, as it was for TB Lab.
Para darles las pautas de cómo está compuesto nuestro
To
Sistema
guide you
Nacional de
into
Salud en
how our
Ecuador,
national
creo
healthcare
que
system is
consideramos como
comprised in
equipo que es
Ecuador.
importante
As a
presentarles a
team, we
ustedes
feel that it is
cómo está
important for
conformado
you
el
to
mismo.
learn
Dentro
how
del
is it that
Sistema
it's put
Nacional de
together.
Salud tenemos a
Within the
dos grandes
national
redes.
healthcare system,
La
we have
primera red,
two
que es la
big
Red
networks.
Pública Integral de Salud,
The
que
first one is
conforman
the public
varias
comprehensive
subsistemas que
network
son
that brings
aseguradoras de
several
salud, y
subsystems, which
un
are
segundo,
healthcare
una
insurers,
segunda red que se
and
llama
a
la red
second
privada
network called the
complementaria.
private complementary
Todo
network.
esto conforma el Sistema
All
Nacional
of
de
this
Salud del Ecuador.
is what comprises the
Abajo
national
ustedes
healthcare
tienen
system
unos
in Ecuador.
porcentajes de cobertura de
Below you
salud
find
de acuerdo
percentages.
a
These are
las
healthcare
prestaciones que cada
coverage
subsistema
percentages
tiene.
according to
En
the
cuanto al
services
punto
rendered by
20, a
each
la Red Pública
subsystem.
Integral de Salud,
And the comprehensive
tenemos a
public
la cabeza el
network, we
Ministerio de
have
Salud,
the
la
Ministry of
Seguridad
Health,
Social,
then
la
Social
seguridad
Security,
prestada para las Fuerzas
then
Armadas y la
Social Security
seguridad prestada
provided for
para
the
la
armed
Policía Nacional.
forces and for
Como ustedes pueden
the
ver las
National
cifras, la
Police
gran mayoría de
Department.
cobertura
As you
está
see
siendo
with the
llevada a cabo
figures, most
por el
coverage is
Ministerio de
being
Salud.
provided by the Ministry of Health.
Cabe mencionar
It's important to
que
also
el
mention
Ecuador está formado
that Ecuador
de esta red
has this
que les dije
network
anteriormente y además el
that
Ecuador
I recently
como
mentioned.
Ministerio de Salud en cuanto
And
a
as the
cobertura
Ministry of Health, in
dispone
terms of healthcare
a través del
coverage,
Ministerio de Salud
has
la
through the
rectoría
Ministry of Health
para el territorio
the rectory
ecuatoriano
for
en todo el,
the
en todo el
Ecuadorian
Sistema Nacional de
population
Salud.
all
A
throughout the
partir
national healthcare system.
del mes de marzo de este año,
So since
por decreto
March,
ejecutivo, vuelvo y
recently, by
reitero,
executive
nosotros
decree,
tuvimos
once
una
again, we had
reestablecimiento de
a
la estructura nacional,
reestablishment of the
conservando la
national
rectoría por parte del
structure,
Ministerio de
keeping
Salud.
the rectory
Pero esta
done by the
rectoría
Ministry of
está
Health, but this is a
obviamente acá
rectory
en las
that
oficinas de planta central
is
y
centered,
trabaja de forma directa
it's
con las
centralized in
direcciones
central
provinciales,
offices and
24 en
working
total,
with
así
the
como las
24
oficinas técnicas.
province departments and
Dentro
the
de este
technical
marco,
offices.
obviamente, están
Within that framework, then,
los hospitales y
we have
demás centros y establecimientos de salud.
hospitals and other
Como
centers and
respuesta
healthcare
nacional de VIH,
institutions.
dentro
As a
de
national response to
Red
HIV
Pública Integral de Salud,
within
por
the
sus siglas
public
RPIS, nosotros
integrated
contamos con
network,
64 clínicas, si
in
ustedes
this
quieren
case,
llamarlas, que les
the
denominamos
acronym is
UAIs o Unidades de Atención
RPIS.
Integral de VIH.
We have
En cada una
52
de nuestras
clinics that we call
provincias tenemos una unidad
UAIs.
y
In
además
each of our
disponemos
provinces, we have
de
one
12
unit,
unidades
and then
aliadas
we have
al
12
sistema
partner units into the
de los
system
distintos subsistemas que son Seguridad
from the
Social,
various
Fuerzas Armadas y
subsystems,
Policía.
Social Security, Armed Forces, and
En
National
cada una de
Police.
estas unidades de atención integral
Each of these comprehensive
se
units
ha hecho la capacitación correspondiente
have
para
received
cuando
training
trabajamos en el proceso de
for
implementación.
when we're working
Les
in the
voy a
implementation
comentar en un
process
momento
that I will
del
refer to in a
biomarcador
minute
LAM.
on the LAM biomarker.
¿Cómo estamos con la coinfección en el país?
How are we
De
doing
los
with the
datos manejados
co-infection
por
in the
ambas
country?
estrategias TB
Out of the
y
information that we have
VIH,
from all these
nosotros
strategies,
disponemos
TB
de
and HIV,
la prevalencia de
we
coinfección
find the
TB
prevalence of
activa
co-infection
en el año
TB
2025 ha
active in
disminuido a
2025 to have
8.8,
been reduced to
pero asumimos
8.8.
que es un tema
But we
de
assume that that has to do
notificación del caso, así
with
como de
the notification
implementación
of
del
case
reporte que
as
les
well as the
vengo a
implementation of the
comentar a
report that
continuación.
I'll tell you about in
Entonces, cuando
next.
conversemos acerca de nuestro
So when we
biomarcador
talk
LAM,
about
como digo,
our
el Ecuador siempre
I'm
somos
sorry, when we talk about our
muy
biomarker
receptivos
LAM,
ante
in
las
Ecuador we're
normativas
quite receptive in
internacionales
terms of the
y
international
estuvimos muy
normativity,
pendientes como país en
and we
esta
were
nueva
very
implementación a
much
nivel tanto mundial como
aware as a
regional.
country in this
Por lo
implementation
PS, por ejemplo, se
globally
acaba
and
la aplicación de la
regionally by
implementación de LAM
PAHO
a partir de noviembre del
from
21.
November
El Ecuador a partir
2021,
de enero
where
decide
Ecuador,
tomar
starting from
este tema
January,
de
decided
a ver cómo le
to
hacemos para
from this to see how do
adoptar
we do to
este
adapt
biomarcador dentro de
this
nuestros algoritmos
biomarker
diagnósticos de
within
cuanto al
our
manejo de las personas
diagnostic
que viven con
algorithm and the
VIH.
management
Y
of
es así
individuals living with
que asumimos
HIV.
este reto en
So
el
we
año
assumed the
22.
challenge in 2022,
En el año 23 y
and in
24, mientras
2023 and
especificábamos el tema
2024, while
de
we
la
were
normativa
validating the
nacional,
topic
no
in the
solo con la
national
normativa, sino
normativity, not
establecida en
only with
garantía de
guidelines, but also
cobertura
established
gracias a la
in
estrategia de
and
tuberculosis,
in a
nosotros hemos
guideline, and
podido,
thanks to
de
the
hecho, incluso
tuberculosis
recapitular como
strategy, we
país
have been able to
muchos errores cometidos en
revisit
el momento de
many
la
mistakes that we
implementación
made at the
de la
time of
política, siendo
implementing the
uno de los
test,
principales errores
being one of the
la
most important
recapacitación
errors,
del personal,
the
debido a que como
retraining
todo
of our
país
staff,
tenemos
because every
personal
country,
demasiado cambiante
as every
y
country, we're also
además
always having a lot of
la
rotation.
interpretación
And then the
de esta nueva
implementation
molécula
of
para
this new
nosotros nos
molecule
permitió tener
to
un
us
amplio
was what allowed us
conocimiento
to have
y
a
sobre
greater
todo
knowledge,
se abrió puertas muy
particularly
interesantes
opening
hacia
very
las
interesting
unibacterias no
doors
tuberculosas,
toward
así como
non-tuberculosis
también
bacteria,
para la
mycobacteria,
interpretación,
as
como
well
la
as for the
colega de Brasil nos
interpretation,
comentaba,
just as our
sobre
colleague
el
from Brazil
tema
had
de los
told us
falsos
on the
positivos que
topic of the
teníamos
false positives
en
that we have
nuestra
found
carrera de
in
implementación.
our
Hicimos los
implementation
ajustes de
journey.
estos 2 años y finalmente en el 25 nos sucedieron dos cosas buenas.
We did
Fuimos
the
más
adjustments
simples
in
en
these
nuestro
2 years, and
abastecimiento
two great things
determinando
happened in
porque ya
2025.
tuvimos
We were
conocimiento.
very
Nos tomó
clear
un
in our
tiempo el
supply
recorrido, pero ahora
because we
somos
already
mucho
had
más
knowledge. It took us some
fuertes
time, but
y
right now we're so
decisivos
much
y
stronger and
convencidos
decisive,
para
and we're
pregonar el buen
convinced
uso del LAM en las
to
personas que viven
disseminate the
con
good
VIH.
use of the lamb
¿Por
in
qué?
people who are
Porque
living
ya
with HIV. Why?
nos
Because
enamoramos de este tema.
we
De la
are
misma
already in
forma,
love with this.
tuvimos el
In the
segundo
same way,
factor.
we have the
El
second
doctor Camilo nos ha
factor.
acompañado
Dr.
y al
Camilo
equipo de
has
VIH
supported
en
us
el
and the
tema de
HIV
enfermedad
team
avanzada.
in
Junto
advanced
con Colombia,
disease.
nosotros
Together
estamos un
with
poquito más
Colombia,
adelantados
we are
para la
a bit more
implementación a
advanced
través del
for the
catalizador de la
implementation through
enfermedad
the
avanzada, poner
catalyzer
en
of
práctica
advanced
el
disease
paquete
and putting
de
into
intervención
practice the package
de
of
la enfermedad
intervention
avanzada. Y es
of
así
advanced
que
disease.
nosotros nos hemos proyectado como
Um,
país el
and
asumir
that's how we projected
dentro
as
de
a
nuestras
country
competencias como
to
programa y
assume
proyecto de
as part of our
VIH
consequences as a
el tema
program and
de la
HIV project,
adquisición regular,
the
permanente
regular and
y
permanent
consistente y
acquisition
sostenible
and
de esta
consistent,
biomolécula
sustainable acquisition of
y
this
hemos
biomolecule.
generado todo un
And
proceso
we
bastante amigable para la
have
implementación del LAM en nuestros
developed a
sistemas de
very
reporte y
friendly
en todas
process
las
for LAM in our
instituciones
reporting
elaboradas que ya
system.
les voy a hablar a continuación.
And we
Cuando nosotros
have,
empezamos a
and we're going to
implementación
be
del
talking
LAM en
about this.
nuestras
And
clínicas
we
de
talked
VIH,
about the LAM interpretation
tuvimos
in
que
our
ser muy
HIV
fuertes
clinics. We
en
had to be
temas de
very strong
capacitación y convencer a la
in
gente,
training and
tal como
convince
decía la colega
people
de
that,
Brasil,
as a
sobre
colleague from
todas las
Brazil was
posibilidades
saying,
que
on all
podíamos
the
tener
possibilities that
como
we could have
limitaciones a esta prueba,
as limitations,
porque ustedes saben
because
como público experto que
you know,
existen
as an
personas que
expert
solamente
audience, that
tienen
there
miedo al
are
cambio.
people who just
Y aquí
are
vemos
afraid to
cómo nos
change. And
fuimos
here we see
planificando nuestras
how we
solicitudes
started like planning
de
our
esta
requests
biomolécula.
of this biomolecule
Y cómo implementamos en el ministerio. Bueno,
and how we
ya
implement in the
ya les
ministry.
informamos, nosotros
Well,
compramos
I already
esto a través
informed.
de una
We bought
planificación de
this
por lo
through
menos
a
18 meses de
planning of at
licitación
least
a través
18
de nuestro
months
convenio plurianual que
tender
tenemos
through
con
our
fondos públicos.
pluriannual agreement with a strategic
Adicionalmente a
fund.
esto, tenemos
And
un sistema
additionally, we
de
have a
información que
system,
nos permite
an
dar
information system that
resultados.
allows us
Es
to
un
give
sistema
results.
interconectado.
It's an
Estamos
interconnected
jugando para ver
system.
cómo
We are
podemos
playing
conectar
to
a todos
see
nuestros
how we can
subsistemas,
connect
que se
all of our
denomina PRAD
subsystems
y tiene registro
um,
único.
that have a
Y
unique
por
or
supuesto,
single
creemos y
registry.
confiamos
And of
en que
course,
el
we
tema LAM
believe and trusted TB-LAM
que jugar
together
en el
has
diagnóstico
to play
de
with the
las personas
diagnosis
que viven
of
con
the
VIH y
people who
tenemos
live with
un arsenal,
HIV.
un
Um,
trabajo mancomunado y
we have
conjunto de
an
las dos
arsenal, a
estrategias
joint
en
work
la
of the two
adquisición de
strategies, in the
129 equipos en
acquisition of
cada una de las provincias
129
en los 3
teams
niveles
in
de
each one of the
atención que
provinces in
nos
the three
permiten
levels
poner
of
en
care
práctica el
that allow us
algoritmo
to put into
diagnóstico
practice
de la
the
enfermedad
diagnosis
de TB.
algorithm of TB
¿Cómo nos
illness.
fue con los subsistemas?
How did we
Debido
do
a
with the
que
subsystems? Due to the
el ES es
fact
nuestro segundo subsistema
that
prestador de
um,
servicios en nuestro
the
Sistema
ES is
Nacional
our
de Salud,
second service
hicimos
provider
toda la
system.
abogacía
We did
suficiente
all the
para que ellos se
advocacy
sumen al
for them
convenio
to add on
plurianual
to the
con el
pluriannual
Fondo
agreement
Estratégico para
with the
permitirles
strategic
tener
fund
un acceso pronto y
to allow
rápido
them to
al
have
TBLAM.
fast
Y en el tema de Fuerzas Armadas y
and
Policía,
soon
al
approach
ser
to
una
TB-LAM and access to
población
TB-LAM.
no muy grande
And
para nosotros
since
como
this
VIH,
is not such a
las
big
hemos
population for us
asumido y
as
con TB
HIV,
hemos
we
asumido el
have
proceso
taken
de
on the
referencia y
process
contrarreferencia sin
of
demora
reference and counter
de,
reference without
de
delays
resultado para que el
of results
ministerio
so
asuma
that the
la
ministry can
detección de
take
LAM a
on the
través
detection of
de
LAM
nuestros laboratorios
through our labs
para las Fuerzas Armadas y Policía
for the
Nacional.
armed forces and national
Finalmente, a
police.
través de nuestro sistema PRAS,
Now, finally,
hemos
through
dado
our PRAS
apertura
system,
a
we
través
have
de, como ustedes
opened,
pueden ver en la
as you
gráfica
can
del
see
lado derecho
in
arriba
the graph on my
superior,
right,
con el módulo de
with
VIH
the
externos, podemos
external
contar con
HIV module,
información
we
en
can have
línea al tiempo
information online,
sobre el uso de TBLAM
real
dentro del
time on the
diagnóstico
use
de la
of TB-LAM
coinfección.
within the diagnosis of the
Por
confection.
tanto, por
Therefore,
antonomasia, nos juntamos las dos estrategias
we brought together both
en
strategies
en este proceso que yo
in
traigo
this
a colación.
process
Sabemos
that
que
I
han
bring
pasado
up.
muchísimos años
We know that
desde
it's
que se
been many
generó
years since
este accionar
this
de la interprogramación y
action of
actividades clave
interprogramming
para
and key
generar el
activities was
tema de
generated
las
to
actividades TB-VIH,
generate the TB
pero
HIV
hemos generado
activities. But
justamente
we have generated
hoy por hoy estos servicios integrados de tuberculosis
integrated
y
services
VIH
for TB and HIV.
y esperamos ser
And we hope
proactivos y
to
soñadores
be
y
proactive
poder
and
mostrarles a
dreamers and be
ustedes
able to
en el
show you
siguiente,
all
lo que queda de este año,
in what's
cómo
left of
vamos
the
a hacer el
year
modelo de
how we
gestión
are going to
para la
do the management
desconcentración
model
del
for the
tratamiento de
deconcentration
VIH
of the
en el primer
treatment of
nivel, donde
HIV
entra
in the
el
first
primer nivel de
level
atención y
of
de
where it
esta
goes in the
forma
first level of
reducir la carga
attention
de tuberculosis en
um,
las personas
and
con
to
VIH
reduce
en el
the burden
marco
of
y en el
TB in
sostenimiento
people with
de como
HIV
respuesta
in the
nacional
framework of the
de la Estrategia
sustainment
Mundial y Regional
as
de la Eliminación de
uh,
las 30
the national
enfermedades.
strategy for the elimination of the 30
Finalmente,
diseases.
consideramos como
And then
entre los dos
finally,
programas como
and within
oportunidades
the two
fuimos
programs we consider
engatillados y fuimos
as
catalizados
opportunities,
debido a que
we
formamos
were
parte del
catalyzed due to the
estudio
fact that
regional de
we formed a
enfermedad
part of
avanzada
the
y
regional
ahora somos
study
unos
for advanced
convencidos de la
illness,
implementación
and
de
we
este
are now
paquete
convinced of the
a todo el
implementation of
Sistema
this
Nacional
package
de Salud,
to all the
principalmente
national health system,
y
mainly
un
the
tema
guideline,
puntual del paquete
um,
de la intervención que obviamente
and the
contempla
package of
TB-LAM
intervention,
y por supuesto
and that
el TBT.
contemplates TVLAM and
Además,
2T, and of
como
course,
brecha, sabemos que
that
tenemos
as
que
a gap,
mejorar nuestro
we
sistema
know
de
that we
información
have to
y que
improve
tenemos
our
que producir
information
datos
system,
mucho más robustos de los que al
and
momento
that we
estamos
have to produce
presentando
much more robust
en
data
cuanto a la
than what we're
búsqueda activa
presenting
de
um,
tuberculosis en los PBBs,
in the
para
active search
finalmente
of TB in the
considerar
PVPs
como un
to
reto
later, then
que nuestro
finally
país,
consider the challenge
como
that
muchos de la región,
in
por
our country,
momento
as many in the
traspasa
region
y atraviesa cambios
uh,
estructurales
are going
importantes
through important
en donde
structural changes
necesitamos la
where we
abogacía
need
y el esfuerzo de
advocacy
todos
and the
para que
effort of
estas
everyone
indicaciones o
so that these
disposiciones no afecten,
indications don't
sobre todo en el
affect,
impacto económico para la garantía
especially in
de
economic
contar con
impact for the
esta
guarantee,
y todo
to
nuestro
have
arsenal y nuestra
this
cartera de
in our
servicios en
arsenal
cuanto a la
of
respuesta a la
services in regards
coinfección
to the
de
response and the
VIH.
co-infection
Muchas
of
gracias a todos los
HIV.
colegas.
Thank you so much to
Con
all
esto finalizo la
colleagues.
presentación,
And with
doctora
this,
Yerovi.
I close with a presentation.
Muchísimas gracias,
Thank you so
doctora
much,
Yerovi,
Dr. Jeroi,
por la presentación, por
for the
compartirnos el ejemplo de la
presentation, for
experiencia
sharing the
del
example
país,
and
aún
the
con la
experience
afonía.
of the
Creo que ha
country.
sido muy clara.
Um,
Yo creo que de
I
nuevo
think you've been
agradecer
very clear,
tanto a
and I
Sandra
want to
como
thank both
María
Sandra
Gabriela
and Maria
por las
Gabriela
presentaciones. Ahora vamos a
for
tener
the
un espacio.
presentations.
Ya,
We
bueno,
will
vamos
now
un poco mal
be
con la agenda
having
por
a
el tiempo,
space.
pero todavía
We're
tenemos unos
running late, but we
minutos
still have a
para
few
poder
minutes
abordar preguntas preguntas que tenga la
to
audiencia
be able
sobre las
to
experiencias del
address
país o también sobre
questions
las
on the
presentaciones
experiences of the
técnicas
country or
previas
the
sobre el
previous
tema del
technical
LAM y las
presentation on
recomendaciones. Para ello
the
yo voy a
LAM and the
dar paso
recommendations.
a
And for
Belkis,
this, I will be
Marcelino,
handing the
Antonio
floor to
Camiro,
Belkis,
para
Marcelino,
que por
Antonio
favor nos
Camilo,
apoyen con esta sección.
so
Gracias.
that they can support us with this session.
¿Me escuchan?
Can you hear me?
Perfecto, Belkis.
Perfect, Belkis.
Tengo dos pantallas, perdón. Sí, sí. Muchas de las preguntas, como
Um,
mencionó Pedro,
A
se
lot
han
of the
estado
questions
respondiendo en la
that
sección de
Pedro mentioned
preguntas
have
y
been
respuestas.
answered in the
Entonces,
Q&A session.
estoy abriendo. Entonces,
So I'm
quisiéramos hacer
opening,
una pregunta
and we would like to
a
ask some
nuestra,
questions
una pregunta al doctor de las que están
to the
acá, al
doctors,
doctor
of the ones that
Ernesto.
are here, to Dr.
Una de las
Ernesto.
preguntas que
One of the questions that
cuando hablaban del costo de prueba,
when we talked
que es
about
por
the
economía
cost
de
of the
escala,
test,
si está
which is
disponible
because
el
of an
apoyo
economy of
estratégico y
scale,
todo lo que
if
se
it's
está haciendo
available
para
for the
asegurar
strategic fund and
que todos
everything
los
that's
países
being
puedan
done
acceder a
to
través
ensure that all
de
countries
de la
can
programación anual que
access
hacemos en el
through
fondo
the annual
estratégico
scheduling that we do in
el
the
tema de
strategic fund
para la adquisición. Doctor
and for the
Ernesto.
acquisition. So, Dr. Ernesto?
Gracias, Belkis. Sí, el precio que poníamos en
Yes,
referencia,
Belkis.
que
The
consta de
price
los
that we
dos
were
equipos,
putting
es decir, el
for the
Thermolife
reference
y el
of the
Minidot,
two
son
devices, the Thermalize and Mini Dot,
$335
are
y la tarjeta para
$335,
realizar cada
and the
prueba
card for
cuesta
each
$3
test
con 60 centavos. Ustedes
is
ven que es un precio bastante
$3.60.
asequible,
You
muy
see that it's very
competitivo
accessible,
en
very
comparación
affordable
con el resto
in
de las plataformas
comparison
moleculares que han
um,
recomendado
to the molecular
anteriormente, ¿no?
platforms that have
Este
been previously
precio es el que
recommended.
aparece en el catálogo del Global Draw
This
Facility
is the price that
y que
appears in
también
the
se
Global
ha
Drop
incluido
Facility
en
catalog
el
and that has also
catálogo
been included
del Fondo Estratégico
in
de
the
OPS.
catalog of the
Es decir,
Strategic Fund
este es
of
el
PAHO.
precio que se ha acordado
And this is the
con la parte
price
comercial, ¿no?
that has been agreed
Se han
upon with
abierto
the
preguntas por
commercial
ahí, Becky,
house.
también, que
And
aunque se
maybe there
respondieron,
was
como tú
another
decías, en
question
online,
that,
pero es
although they
importante.
were answered
Hacían una
as you were
pregunta con
saying,
relación al hisopado lingual
we're asking
para las
question
pruebas
based
moleculares,
on the tongue
si
swab
se
for
puede, si era
molecular
recomendado para
tests, if it
VIH.
was
No, es decir,
recommended
la
for
recomendación es
HIV.
para
No,
todo
the
adulto y
recommendation
adolescente
is
con
for
signos y
every
síntomas de
adult and
tuberculosis,
adolescent with signs and
donde se va a
symptoms of
realizar una prueba
TB,
rápida
where
molecular,
we're
en
going
este
to be
caso
doing a
las que se
rapid
han
molecular
demostrado, por lo que
test.
existe la
Uh,
evidencia, es para el
or what
ESPER,
has been demonstrated
para el
where there's
TUNAT
evidence is for
y
ESPER,
para
for
el Near
TUNAT,
Point of Care, en este
and
caso,
near
que es la
point of
nueva
care,
recomendación del equipo Minidot.
which is a new
Otra
recommendation
pregunta
of
que
the
también
mini
yo creo
dot
que
team.
valdría la pena
And
responder
another
en
question that
colectivo
would
era
be
que
worth it to
preguntaban si las
respond
muestras
in
de heces
collective
para la
was
toma
that
en
if
niños
the
era
samples of
recomendado para
feces
niños con
for
VIH. No, la
children was
recomendación
recommended for
es
children
para
with
todo
HIV?
niño con
No. The
sospecha
recommendation
de
is for every
tuberculosis.
child with a
En
suspicion
caso
of TB.
presuntivo, se debe
In the
recolectar
presumptive case, we have to
simultáneamente para
collect
prueba molecular
simultaneously for
muestra
molecular tests,
respiratoria y muestras
respiratory
estoquestrales, ya
tests,
bien sea un niño
and
cero negativo
um,
o cero positivo
stool
a VIH.
sample,
Esto
even if
ya
the
con la
child
incorporación
has
de esta nueva
HIV
recomendación
or
que
not.
lleva
And with the
algunos años en
incorporation
la
of this new
recolección en material
recommendation,
fecal,
it has
varios
been going
países
on
en la
for several
región lo han
years.
incorporado a
Several
sus
countries in the
algoritmos
region have
y
incorporated in
realmente
their
hay
algorithms, and
experiencias ya o evidencias de que se ha
there's
aumentado el
experiences and
número de casos de
evidence
tuberculosis
that the
pediátrica
number
en
of
estos países
pediatric
con
TB has
relación a lo
increased in these
difícil que
countries
resulta el diagnóstico en esta población.
in relation to how
Yo creo que esa
difficult
es
it
la
is
pregunta
to do the
más
diagnosis in this
significativa,
population. I
el
think
resto
these were very
se
significant
respondió,
questions. The other
pero
ones
recuerden
were
que los
answered,
algoritmos,
but remember
cuando
that the
hacemos un
algorithms,
caso
when
presuntivo
we have a
de
presumptive
tuberculosis,
case
signos y síntomas de
of TB
tuberculosis,
with
una persona
signs and symptoms
seropositiva,
of TB, a
donde
person that is
recomendamos
seropositive,
simultáneamente
and
la
where we
realización
recommend
de la
simultaneously
prueba
doing
rápida
the
molecular y el LAM,
molecular rapid
cualquiera de
test
las
and the
dos
LAM,
pruebas que resulten
any
positivos
of the two
ya es
tests that are positive
indicación de
are already an
tuberculosis activa, porque esa
indication
es la ventaja que
of
nos presenta esta
active
prueba,
TB, because this
tuberculosis
is the
activa y
advantage
por
that
tanto
the
un
test
tratamiento
presents,
inmediato
active
con
TB, and therefore
fármacos
an immediate treatment uh,
de primera línea, ¿no?
with first line
Esa es la
medications.
utilidad de poder realizar
That's the
esta
use
prueba.
of being able to do this test.
Gracias.
Thank you.
Muchas gracias, Ernesto. Me
Thank you,
gustaría la
Ernesto. I
siguiente
would like the
que podría
next
responderla tanto la doctora
question could be
Simide
answered by Dr. Simire
como
or
el doctor Camiro.
Dr.
Fue una
Camilo.
pregunta relacionada con los
It should be
pacientes
a question
asintomáticos
related
con
to
TB-LAM
asymptomatic
positivo.
patients
Todo el tema de la
with TB
evidencia de por
positive
qué el
with
tratamiento
the
se debe
evidence
garantizar el tratamiento.
of
Sabemos que fue respondido
why
tanto en la
we should
presentación
guarantee the treatment.
como
We
en
know
la
that
respuesta,
we
pero quiero
have
volver a
answered
retomar
this
esto.
in the answers also and in
Pacientes
the presentations, but let's take this again. Asymptomatic patient with positive TB LAM with empirical treatment.
Si puedo empezar a responder solo
And this is to
acotar siempre
start
que el TB-LAM tiene
responding.
que
Oh,
hacerse
is
en el contexto
TVLAM has to be
correcto. O
done
sea, es muy
in
difícil para
the right
nosotros hacer una
context. It's very difficult
recomendación
for us to do a
fuera de la
recommendation
población ya bien
out
estudiada,
of the
que son
population that
personas
has been well
infectadas por
studied,
VIH con menos de 200 de
people with
cobertura específico
HIV,
y
um,
o que tienen síntomas o
or
activos de
who
enfermedad por
have
TB activa, ¿no? En
symptoms
estos casos
of active
es
illness. In these
difícil,
cases, it's
altamente infrecuente
difficult
encontrar a
and
alguien que esté
highly infrequent
verdaderamente
to find
asintomático.
this
O sea, en la
in
experiencia que
truly
tenemos,
asymptomatic patient.
mínimo tendrán
The
aunque sea algo
experience
de
that
pérdida
we
de
have,
peso, puede que tengan alzas
there can be a
térmicas,
bit
algo de
of
tos,
weight
pero así como
loss.
realmente encontrar a alguien asintomático será raro.
So
En
absolutely
dado caso que
asymptomatic,
encuentren a
it's
alguien
not, it's
completamente
not, it's
asintomático
very
que
strange.
cumple los
To find
requisitos para
somebody
hacerle la
completely
prueba,
asymptomatic
hay que
that
darle
meets
el
the
altísimo valor
requirements,
diagnóstico
we
que
have to
tiene
give
y
it a
tratarlo como
very
una TB
huge
activa.
value and
Ahorita
treat
le
it
paso
as
la
an
palabra a
active
la
TB.
doctora Subire para
And
que
I will
hable
be
un
handing the
poco más de
floor
la
to the
razón del por qué
doctor
puede
so
pasar
that
esto.
she
No
can
es
go
exactamente
and delve
conocido
into
al
the
cien por
reason
ciento
why
de por
this
qué
can
puede llegar a
happen.
pasar,
Um,
pero puede ser por temas de carga
and
vascular
this
o
can be
porque todo
because
lo que se nos
of
explicó
vascular
de
burden
los
or
granulomas
everything that
poco
has been
viables que hay en
explained
estas situaciones.
with
Adelante, doctora.
about the granules. Thank you, doctor.
Obrigada. Eu peço desculpas, eu vou continuar em português.
Sorry, I have to continue
Deixa eu
in
só para
Portuguese.
refazer a frase,
I
quando um
think
indivíduo
that,
tem, como bem disse
only
o
to
Dr.
summarize,
Camilo,
when an
se
individual,
o teste foi
as Dr. Camilo
solicitado
said,
dentro dos algoritmos
it has, if the
corretos
test
e
was
foi
requested
executado de
within
fato
the
correto,
algorithms
resultado
and it was
reagente é
executed
reagente.
correctly,
E o
the
tratamento
results
deixa de ser
are
empírico, ainda que a gente não seja
reactive.
capaz de dizer que o paciente tem
I think that the
sintoma, tem
treatment is not empirical
X
anymore.
amostrinha em uma alteração. É muito possível que a
Although
gente
people
esteja
have
detectando
to
a
know that
doença, a
there's,
tuberculose, num
although
momento
the
ainda
X-rays have
em que o
no
paciente
alteration in
não tem
detecting
sintoma. Portanto, é um
TB
ganho. Acho que no começo da
at a specific
apresentação foi
moment where
mostrado
even though the patient doesn't have
um
any
gráfico
symptoms.
muito
So at the
interessante
beginning of the
de que
presentation,
mostra
there was a
que
very interesting
pessoas com
graph
LF-LAM
that was shown that shows that
reagentes e não
people with
tratadas
LAM
morrem mais do que a
that are
população,
reactive
do
and
que as pessoas
non-treated
com
died
LF-LAM negativo. Portanto, é um
more than the
diagnóstico de
population of
tuberculose
people
que permite
with
o
that are
diagnóstico de
LAM negative.
tuberculose até
The
quando a pessoa
diagnosis
ainda
of
não tem
TB
sintomas.
allows the diagnosis even when people don't have symptoms.
Muchísimas gracias tanto al doctor Camilo
Thank you so much
por
to
la
Dr.
Yo quería un
Sorry,
poco enfatizar en esto
I want
con
to
relación a la
emphasize on this
incorporación de una persona que sea
regarding the
cero positiva al
incorporation of a
VIH
person.
o
They can be
seronegativa
seropositive to
cuando lo
HIV or
incorporamos a un algoritmo
seronegative.
diagnóstico
We
y es porque
incorporate them
estamos
into
pensando
a
o partimos de
diagnostic
un
algorithm
diagnóstico
is because when
presuntivo
we're
de
starting
tuberculosis,
are based
donde
on a
previamente
presumptive
hacemos una detección por
pre-
cualquiera de los
diagnosis
métodos
of
que existen
TB,
en este
and we do a
estos momentos,
presumption based on
pero
the
estamos
methods that we
partiendo
see
al
right
menos
now.
un
But
diagnóstico
we're
presuntivo de
starting
una persona que
from a
presente
presumptive
síntomas o
diagnosis, a
signos de
person who has
tuberculosis.
signs
Y
and
esto
symptoms of
nos
TB,
aumentaría el
and
valor
this would
positivo
increase
de
the
la prueba que
positive
estaríamos
predictive
haciendo en
value
detección.
of the
Ya
test that
mencionan
we
prueba
could be
molecular,
doing,
que a veces
and
entonces
well, we already do a
cuestionamos, ¿es
molecular
un
test
falso
that we
positivo?
question,
Pero
is it a
tenemos que
false
tener en
positive?
cuenta que
But we
no,
have
que
to
estamos
keep in mind
partiendo
that
de
we
un
are
diagnóstico
starting
ya, en
from
este caso
a
presuntivo, y pensando
diagnosis
que es
that is
tuberculosis,
presumptive
por eso
and
lo
considering
incluimos en
that
un
it's
algoritmo,
TB,
¿no?
so that's
Y
why
eso
we would
después a
include it
veces
in
lo que
an
nos trae la
algorithm.
discordancia
And
entre
that's
la
what brings us
clínica
the
y
discourse
también
between
entre los resultados ya bien sea de
clinical
una prueba molecular
science
o de
and
una prueba
results
bacteriológica.
by molecular or bacteriological test.
Muchísimas gracias, Ernesto.
Thank you
En
so
ese
much,
mismo
Ernesto.
sentido, hay
In the
una
same
última
sense,
pregunta que entró,
there's
que está
a
todavía sin
question
responder en
that
preguntas
had
y
been
respuestas,
answered
donde
in the
decía, ¿podría
Q&A.
por favor confirmar si al tener una prueba de LAN
So
en
could
orina
we confirm
positiva,
when we have
entendemos
the
que
positive
sería
inline
una
test,
TB extrapulmonar confirmada?
it could be with a confirmed extrapulmonary.
Camilo o la doctora
Camilo
Sumire,
or
perdón,
Dr. Sumire,
Yo puedo contestar. O sea,
I
depende
can answer
mucho
that.
si hablamos desde cómo reportarla,
It
por así
depends a
decirlo,
lot
de
on if we
cómo
talk
se
about how
maneja
to
la
report
normativa
it.
local en tu país por el programa de TB. El hecho de que
So
exista una prueba de
the
TB LAM
fact that there
positiva
is a
implica
positive
que
TB
está
LAM
llegando la
test
micobacteria a
means
orina
that the
y por ende
mycobacteria
es
is reaching
diseminada.
urine and
Esto
that
se
it's
debe de
therefore
reportar como una
disseminated,
TB
and this must be
extrapulmonar.
reported as an
Puede persistir como
extrapulmonary
una TB
TB,
pulmonar o puede
and
ser pulmonar la principal
it
manifestación clínica o en donde sea la
it can
principal
be the
carga de la
main
enfermedad, pero si
clinical
ya llegó a ser TB
manifestation or
LAM
burden
positivo,
of disease.
es porque
But
hay
if it's
suficiente
already
carga de
positive TB
micobacterias
LAM,
en
it's
el
because
cuerpo que
there's
están
enough
filtrándose por la
burden
sangre
of
y la orina como para
mycobacteria
que
that are
salga la prueba
filtered through
positiva.
blood and
Entonces,
urine to
eso nos
get the
confirma que es
positive test.
diseminada y
So this confirms that it's disseminated and therefore extrapulmonary. So it's not the main component.
Bien. Muchas gracias. Sí. Bien, creo que casi todas las preguntas se han
I
respondido
think almost all the
tanto en
questions have been
pregunta-respuesta.
answered
Estoy
in
mirando en el
Q&A.
chat, pero
I'm
no
looking
por
at
si
the
veo
chat.
alguna en el chat.
Um,
Sin embargo, les informamos que
However,
tanto el chat como
I
las
want to
preguntas y
report that
respuestas van a
both the
ser
chat and
compartidas con la
Q&A
presentación a
will
los
be
correos donde
shared with the
ustedes se
presentation
registraron en
to
el
the
webinar
emails where you already
para que tengan
registered
las
to the
respuestas
webinar so
que
that you can
recibieron los
have the
panelistas
answers
en
that
cada
the
una de las
panelists wrote
preguntas y
down in
tengan
each one of the
todo lo que
questions
se colocó en el chat
and
de
have
esta
everything
llamada.
that was placed in the chat for
Pienso
this call. I think
quedamos,
that
eran muchas preguntas para
there
el
were a
tiempo,
lot
para
of
no
questions
cansarlos
for the
mucho
time
con el
that we
tiempo.
had.
Entonces,
Um,
quizás entonces ir
I
cerrando
don't
como
want to
cuando
bore
fuera
you with time,
debido.
so maybe we
Perfecto.
should close.
Bueno, mil gracias,
Dr. Avedillo,
colega. Yo
perfect.
solo
Thank you so
invitar
much.
si
I
alguno más
just
de los ponentes
wanted
quisiera
to
hacer
ask
algún
if
último
any one of the other
comentario.
speakers would like to
eh,
ask any other questions or
Adelante
make
si
any other
quieren
comments.
y si
Please
no,
go ahead, or else
yo bueno, agradecerte, Belkis Camilo, porque han
uh,
conseguido que terminemos en
Belkis,
el tiempo
Camilo,
y
thank you
irlo
so much.
mezclando
I
para
want
que
to
podamos
thank
finalizar.
you.
Quisiera agradecer
And I
profundamente
would like to
a todos
deeply
a los panelistas
thank
por
all the
compartir sus
panelists for
experiencias y su
sharing their
conocimiento. Por
experiences and their
supuesto, al equipo
knowledge.
de VIH y
And
TB
of course,
de
the
UPS, Belkis, sobre
HIV
todo, mil
and
gracias por
TB team
toda la
of
organización
um,
del webinar, a
PAHO.
Néstor
Belkis, thank
Ramiro,
you
a los
so much for the
intérpretes y
organization
a
of
ustedes, a
the
todos los participantes, ¿no?
webinar, the
Por
interpreters, and all the
seguirlo y por las
participants
preguntas tan
for
importantes
following
que nos han
and
compartido.
for
Como ya ha
such
dicho
important
Belkis,
questions
vamos
that
a
you've shared.
compartir
As
en
Belkis
el enlace,
said, we
tienen
will
todas
be
las
sharing,
presentaciones, también
and in
estarán
the link you
las
have all the
preguntas que ha habido
presentations
y
and the
enviaremos la
questions that
grabación
we've sent
al
that
email
have been
de las
made
personas
are also
registradas, pero
there. We
también
will
lo
be
pueden
sending the
encontrar
recording to
en
the
la web de
email of
UPS.
people who
También
are
se
registered, and
comentó
you
al
can find
principio que
this
esto
on the
forma
web of
parte
PAHO.
de una
Um,
serie de webinars
and this is
regionales
part of
sobre
a
el tema
series
de
of
coinfección. Hoy queríamos centrarnos
webinars
en este
on
punto tan importante
co-infection.
del
Uh,
diagnóstico y poder compartir con
we wanted to
ustedes
meet
sobre,
in this
sobre
important
el
part of the
lab y
diagnosis and be
seguir
able to share with
presentando
you about
las
the
nuevas
lab and keep
tecnologías
presenting
de
the new
pruebas rápidas moleculares que
technologies
tenemos.
on
Luego
rapid
vamos a
molecular
tener la
testing that
próxima
we have.
semana, el
And we
1 de
will be
julio,
having
mismo
next week
horario,
on July
sobre un
1st,
tema
the
muy
same
importante que ya también
time on a
avanzó
very
Belkis sobre el
specific,
tratamiento
important
preventivo de la
matter that Belkis
tuberculosis.
already
Hemos visto
talked
que
about
tenemos
on
una
preventive
ventana de
treatment of
oportunidad
TB.
de
We
mejora
have a
muy
window of
importante. Y
opportunity
tendremos un
that
tercer
is very
webinar
important,
más
and a third
adelante
webinar that
que va
we
a
will
ser
be
sobre
having
el
later
tema
on
de adherencia e
on
integración de la
adherence and
atención tuberculosis
integration
VIH para cómo se
with
mejoran los resultados
TB and
del,
HIV and
del
how this
tratamiento.
improves
Y
the
con esto
results
vamos a
of
cerrar
the
con
treatment.
solo
And we will
compartir
be
esta idea
closing,
central que
but
teníamos,
just
que
by
hemos visto
sharing
que
this main
gracias al
idea that we
esfuerzo
had, we've
regional que
seen
están
that
haciendo los
thanks
países, que
to
están haciendo
the
ustedes
regional
en
effort
los
that the countries are
programas, en
doing
los
and
servicios de
that
salud,
you're doing in the
desde las
programs and these
comunidades, ese
health
trabajo
services and
coordinado
from
y
the
estamos
communities and this
pasando de
coordinated
las
work.
recomendaciones en el papel
And we're
o
going from the
digitales a la
recommendations
implementación real.
in
Ya no
paper
solo
or
hablamos de
digital to real
evidencia, sino hemos
recommendations. We
visto
are not only
hoy
talk
que
about
hablamos de
evidence, but
experiencias concretas,
about
experiencias
concrete
reales
experiences
que
and
están
real
cambiando
experiences
la
that are
práctica clínica en nuestra
changing the
región y que
clinical
esperamos que esto
practice
nos
in a
lleve
region
a
and
más
that we
adelante.
hope
Estas,
can
luego
lead
han
us
visto
to
ya todas
advance
las
in this
recomendaciones de
answer.
diagnóstico,
We've
la
seen the
parte
recommendations of the
de LAM,
diagnosis
las
and
pruebas
LAM
moleculares y
and the
necesitamos
molecular
seguir
testings.
expandiendo
And we
ese
need to keep
diagnóstico, seguir
expanding this
expandiendo
diagnosis,
estas
to keep
herramientas de
expanding these
eficacia comprobada que tenemos
tools
hoy
of
disponibles para
proven
conseguir
efficacy that we have
diagnosticar
available
más,
to be
diagnosticar
able to
antes y
diagnose
poder así
more,
disminuir la
diagnose
mortalidad
earlier,
y
and
avanzar
therefore be able
hacia
to
la
reduce
eliminación.
mortality and advance
De nuevo
towards elimination.
agradecerles a todos, con
Thank you
esto
so
nos
much,
despedimos,
everyone.
muchísimas
And
gracias
with
por
this,
su
we say
participación
goodbye. Thank you so
y que
much for
tengan
your
un excelente
participation.
día.
And I hope you have an excellent day.
Gracias.
Thank you.